Good morning on this cold morning in here. This is the Oregon Liquor and Cannabis Commission meeting of December 15th, 2022. Please take the roll.
Richard Curran,
She's on.
I think she's on. Commissioner Curran, you're on, aren't you?
There she is.
there she is.
Yep.
I hope you're feeling well.
Yes, I have been much better than I have been in the past. So I didn't want to get anybody sick today. But
Good.
I probably won't be turning on my camera either, since not looking like my usual self.
Well, we hope you get a speedy recovery. Thank you.
Thank you.
Commissioner Doherty. Here. Commissioner Floyd.
Here.
Commissioner Javon Porter.
Here.
Commissioner Miletus.
Here.
Commissioner Reval.
Here.
Chair Rosenbaum.
Here. Okay, the first item is the approval of the November 17th, 2022 commission meeting minutes. Any discussion? All right.
Chair, I
Commissioner?
move to approve the November 17th, 2022 commission meeting minutes as written.
Thank you, Commissioner.
You're welcome.
Commissioner Curran,
Yes.
Commissioner Doherty,
Yes.
Commissioner Floyd,
Yes.
Commissioner Javon Porter,
Yes.
Commissioner Miletus,
Yes.
Commissioner Reval,
Yes.
Chair Rosenbaum.
Yes. Next item is the report on the observational study of home alcohol delivery. Good morning.
Good morning. Hey there, everyone. This is Jess Nyworth, the Public Health Consumer Protection Policy Analyst here at OLCC. And I also have Julia Dilley, the Principal and Epidemiologist for Rainier Theory here. Julia, would you hop on? There she is.
Good morning.
Great. So we're going to go ahead and dive in to our study report, if that sounds all right with you, commissioners.
That's fine. Thank you.
All right. Let me share these slides here. Oh. All right, so. Oh, good, you can see it all. So this is our final data collection report for this year. And again, Jess Nyworth here from OLCC, and then Julia Dilley. If you probably have seen many reports from her over the years in cannabis and alcohol. She is a nationwide renowned epidemiologist and researcher. So we're really lucky to have her here in the Pacific Northwest. So first, I wanted to provide a huge thanks to the National Alcohol Beverage Control Association for the grant funding for this project. Also, thank you to our fantastic advisory team that consisted of members from OHA, the Alcohol Drug Policy Commission, State Police, McMenamins, and an OLCC investigator for setting the direction of the study. Also, a big thank you to our local coordinators for recruiting participants locally here in Oregon. So what is this study? The Oregon Liquor and Cannabis Commission provides oversight for alcohol sales, including compliance for ID checking to limit minors' access. However, we have no uniform established procedures or authority for monitoring and enforcing various types of alcohol sales practices during delivery to private home settings. And so we really wanted to see, given this limited line of sight, what was really happening at the door. So this delivery study was an assessment project designed to provide information about whether good practices for alcohol distribution are being followed during home delivery of beer, wine, cider, and cocktails to go by third-party delivery services. Young adult volunteers documented whether identification was checked during legal purchases of alcohol for home delivery in Oregon. We also use the lens of what we can do with this information. Essentially, do we, OLCC, have the resources and authority to address the needs that have been identified? Those are project methods. What did we do? So we looked at recorded deliveries for beer, wine, cider, and cocktails to go in Oregon. We recruited adult volunteers between the ages of 21 and 26 to record information about a purchase that they planned or that would be normal for them. These volunteers, their ages were specific because they are of legal age to purchase alcohol, but young enough that their ID should be checked during an alcohol purchase. We intentionally asked for volunteers to conduct a normal purchase. We didn't want to encourage anyone to drink more than they usually do or use an app that they don't normally use. We use an online form that's used across the country to record observations about the alcohol purchase process, including photos and stories if applicable. And again, these observations are not intended for enforcement action. This is a point in time study to get a look at what is happening at alcohol delivery to the door. Our study period was May 16th to September 6th this summer in 7 counties across the state. We had 106 total observations recorded by young adults ages 21 to 26 through the most used third-party vendors in Oregon. And you can see this little map of where we actually conducted those studies and had those volunteers. While we did focus primarily and did have most volunteers on the I-5 corridor, primarily it's because those are either major metro areas or our university areas, which you wanted to see. We have more young adults in that area, wanted to see if this was happening in these cities. So these are just some examples of what was purchased and delivered. You'll notice the majority of the items included the mandatory contains alcohol requires signature sticker. But again, we're looking at beer, wine, cider, and cocktails to go delivery. Primarily, the deliveries that we had were beer, wine, and cider. Actually, primarily beer and cider, and then a handful of cocktails to go. So let's look at our results. We use the following definitions cleared through our OLCC experts, using these definitions to look at what determines compliance at the door. So non-compliant, we had 3 different definitions here that deliveries could fall into. One was a no contact delivery, pretty straightforward. If it was left on the doorstep with no interaction between the delivery agent and the recipient. And the second was no ID checked. So it may have been verbally asked for their age or their birthday, or asked to sign or print their birthday, but not actually, there's no ID checking in the process. And then the third was insufficient ID check, which was a larger chunk of our results here, was our age was checked with a scanner, but the ID was not reviewed, or the ID was checked but not carefully examined. Our regulatory language requires an ID be presented, and digital IDs were considered insufficient presentation as of 2021. And so we made sure that that was included in our compliance definition, was that the ID was checked and appeared to be carefully reviewed at the door and actually presented. So let's look at our summary of outcomes. Here are our results of this study. We had about 2% that were no contact delivery. Honestly, I was surprised that this was this low, and really happy to see, again, point in time study, that we had so few no contact deliveries. And then we had about 8% that were no ID checked. So for example, we had one participant say the delivery driver called them like 10 minutes after they had dropped off the order and asked them for their birthday so they could complete the order. And that was about 8%. That was 8% of our deliveries. And then a larger chunk of our non-compliant ID checking deliveries were for insufficient ID check. So again, this is the age was checked with a scanner, or it was checked, at purchase, but there wasn't reviewed at the door or not carefully examined at the door. And then 63% were in compliance. It means their ID was checked and was reviewed. So then when we look at some of outcomes in those definitions that we have in our regulatory language, we had 37% which were non-compliant, which if you look at our minor decoy operations for alcohol, it's about on par for that first month when we started doing minor decoys post-pandemic surge. So we've got 63% in compliance for properly checking IDs at the door for alcohol delivery and 37% not compliant. So diving a little deeper into our results, we had delivery drivers, 1 in 3 did not check IDs consistently or in compliance. So 1 out of 3 alcohol deliveries were not compliant for ID checking. And then interestingly, the younger you were, the less likely you were to have your ID checked. So for our youngest group, again, we had ages 21 to 26, they were already young. Among 21 to 23-year-olds, nearly half, so 46%, did not have their IDs checked in compliance, which is, counterintuitive, I think. And then looking at our vendor compliance rates, again, this is a point in time study and not representative data for all third-party deliveries in Oregon, but we did note a difference among vendors, ranging from 47% compliance to 80% compliance. Though some of these providers had very small sample size, notably the 80% compliant providers. And as you know, the smaller sample size, the more that's going to impact what those rates look like. So if you have a lot of deliveries for one vendor, you're going to get a more accurate representation of what their compliance rates looks like. Versus if you have a small sample size, you're going to get, maybe a less accurate view of what delivery happens at the door. And it's much harder to tell without having more information. So here's what we saw by purchase or volunteer characteristics. And we looked at this to see, was there kind of bias that was happening at the door? Were the delivery drivers uncomfortable potentially checking IDs? Or was there something about the situation at the home, at the door for alcohol delivery that influenced proper ID checking? And so we didn't find any differences by race, gender, ethnicity, but we did find by age group. So again, like I mentioned before, 21 to 23-year-olds were less likely to have their IDs checked than the slightly older group. We also noticed that if you're in an apartment versus a home, you're less likely to have your ID checked. And then we noticed if you were ordering later in the evening or the night, you were less likely to have your ID checked. So it was more than double here, or about double here. So 56% that ordered during 6 to 10 p.m., so like dinner and then later into the evening, didn't have their IDs checked in compliance versus those who are ordering around lunchtime. Something that became apparent during the study was that there was a lack of consistent ID checking procedures among providers, so those third-party delivery providers. We had scanning at the ID at delivery of the purchase at the door. So this essentially does the math for the age of the person shown on the ID and was closest to being compliant given our regulatory language. But it doesn't assure that the person with the ID at the door is actually the same person who made the purchase. So for instance, I could have made the purchase and then had somebody else answer the door and they just scanned the ID there. But if I'm underage, and this is just essentially shoulder tapping, we're not doing enough to ensure that we're compliant here for just scanning ID at delivery of purchase. And then the second method was uploading a copy of the ID. So this was during the purchase on the app. And this communicates that a person must be 21 or up or have an ID to check. But it doesn't assure that the ID is the same as a purchase who is of legal age. So for example, I borrowed a friend's and then uploaded it on the app when I made the purchase for food or drink. And it also doesn't replace checking a physical ID because that photo that is uploaded could be a fake ID or an altered image of a valid ID. And again, just having a digital ID presented was not seen to be in compliance in our regulatory language. So finally, what did we learn? Our point-in-time study found that ID checking compliance at the door by third-party providers does not meet OLCC's goal of compliance rate of 90%. Delivery drivers relied on the TAC to check IDs, but in most cases, this doesn't meet the regulatory requirement. What was surprising and concerning was that deliveries to younger people, those in apartments, and those ordering at night were less likely to have their IDs checked correctly. It seems that those indicators would warrant more ID checking than less. And then finally, third-party vendors are using widely different practices. More consistent practices may be helpful for both the delivery persons and the customer to make sure that they are doing all of the right things. So that was our point-in-time study for alcohol delivery to the door, looking at a point-in-time study of third-party providers and what does that process look like to give us a little bit more line of sight into what's happening at the door. I'll be happy to take any comments or questions from the commission.
Just a couple. Interesting study. I think highlights what I think the regulated industry pushed for several years ago, so I think it's good to know, and I think a lot of this is good internally for our staff to know. I'm glad that the stakeholders were bringing up this because ultimately it's their thing, but ultimately there is a gap legislatively in this sort of new on-demand economy, and so yeah, it's good, but in a sense we're pointing out things that we've tried to fix systemically years ago, and there's a lot to it. So yeah, I'm interested to hear the whole thing because we're all on the same page of what we want to accomplish. It's just that there's a lot to it. So that's my only thought.
Commissioners?
Yeah, I've got a question. How do the drivers or the vendors, do we give them training or do they have training on doing this? Or are they held accountable at home besides us? What's their?
Yeah, so I can address some of that. So currently, those that are doing alcohol delivery of beer, wine, and cider to the door are only required to register with OLCC. But they are not licensed or permitted by OLCC, which would need a statutory change. So any education or training that is required of them has to be initiated in our current system from the vendors themselves.
Thank you.
Hey, so
So
Jessica,
Mhm.
so the third party delivery guys, right? So we're talking DoorDash, Uber Eats, Grubhub, all those. Would they need to be a part of our system as licensees before they're, I don't know how they are. Some cities are different. Sometimes they're subcontracted, the employees, sometimes they're employees, but would they need to be licensed under our system and then their employees or subcontractors be permittees?
That's certainly an option. That option would give us kind of the most line of sight into making sure that the vendors themselves and the individuals who are delivering alcohol to the door are in compliant. Looking at OLCC's mission to ensure that alcohol stays out of the hands of minors, that would certainly align with our mission. I think there are likely a couple of ways it could be done, but when I think about how we are able to ensure that all alcohol sellers in the state are in compliance with our regulatory and statutory rules, having the vendors themselves be licensed and having the delivery persons be permitted would certainly give us the most regulatory oversight.
I agree. what happens though, and Steve, maybe you can answer this. What happens when those outfits they don't have employees, they're subcontracted, those drivers are subcontracted, right?
So one of the, Steve Marks, for the record, Executive Director, one of the concepts out there is for those that would be contract drivers or independent operators, that you would permit them to the same training. And then you'd hold them responsible for the delivery on the door. You know, one of the most important things, you know, there's a lot of options in permitting, licensing, who you hold responsible for the fines, which I think is primarily want to look at the companies, right? In a lot of states, it might be the licensee that's using the company and that. So there's discussions about how to do that. I think the important thing here is that for the system to work better than it does, we need to not like just see this happen at the door. We need a system of record keeping and retention that we can look at so that we can see when there are complaints, what's actually happening. And then, you know, assign some accountability, right, through fine authority to be able to hold whoever is delivering at the door. You know, and there's a debate, is it the employee, the company who did that, right? Right now it's criminal if you deliver at the door, penalty. So a lot of different facets in how we look at this. I think the legislation we had before, the discussion we had before, a lot more has evolved in the world of digital ID verification. So we're going to have to look at how to utilize that to maximum accountability. So whether you permit them, you register them, all these pieces come into play. I just want to say, this is not just a state issue. This is happening all over the country right now.
Yeah.
The rapid evolution of technology, how you know which companies are doing it well and good, and you know how you might have standards that get these companies in that are meeting, you know, the technology side of the equation. I don't think OLCC has that full capability to do that. So we're going to have to work really closely with the players in this industry that are trying to do a really good job. I mean, they have no interest in making a bad delivery. And certainly licensees, the grocers, the regulators depend on them to provide that service with high compliance. So I think those are the things around the debate, how particularly it would be organized. You know, we've got a concept in, when do we first initiate that legislation, Jessica? I think that was in the 21 session, briefly talked about in 22. But then we were talking about a system. There was a line, and a lot of states do this, like our minor decoy system, where you try to make home delivery sales come with our people having minor decoy buyers when the delivery happens to say, well, that's not going to cover all these deliveries happening in the world. We'd get very little, right? So we need a more systemic approach. And I think the legislation we got takes all the things we're talking about here and provides the forum to debate and craft that system of accountability we need for these, you know, players in the
Sure. Sure. So for either Julia or Jessica, are you seeing any kind of input from the industry, not only in Oregon, but across the country? It seems as though they're just saying, hey, let us know what you want to do as a policy. Is there any input coming from the industry that could be useful?
No, I might actually ask Steve if he would answer that question.
So the answer is yes, right? They are innovating, you know, the technology at the door and how to use it in the system. It's really amazing at some of the ways you can digitally verify ID, or, you know, and have the physical, right? If we need the physical touch or presence too, but we're really talking about having that licensed data right in front of them. So companies, yes, are very focused on this. There is a lot of interest. You can imagine the whole country, right, is looking for them to evolve this, to make sure those deliveries happen better.
But when I see people, we hear that, you know, they're doing the UPS delivery thing, leave it on the doorstep and then take off.
Yeah.
You know, you don't know, oh, I'm going to email you in a minute on my way to my next delivery because time is money.
So interstate carriers, right, that do deliveries interstate are less likely to do the checking at the door. They don't want to have that responsibility. I think the states, and, you know, there might be something else out there, and Tyler, correct me if I'm wrong, but I think the primary interstate regulation that a state has is they have to do some reporting about the deliveries, and they've been doing that, and maybe some training, internal training as well on the interstate carriers. So that's been an issue. Not very many states have cracked any more responsibility on them for their deliveries. And I can tell you, last time when the legislature debated our version of home deliveries, we removed, except for the training, internal training requirement, I think
Was this report mandated by the legislature?
so this was not mandated by the legislature. We were interested in, you know, how well those things were actually being carried out. NAPCA was interested because it was a national issue.
Is that a fund that NAPCA gave us to do
Yeah,
this?
it was a grant.
Is
Yes,
that
NAPCA
10 grand we got from them? Is that?
Yeah.
Oh, so
Yeah,
that,
we applied for funding from NAPCA to conduct this study.
so, it's always appreciated when a report is given to help us do our job more efficiently. That goes without saying. And it's really important for us to, although we may have known it, it's important for us to carry through on these results. I mean, we all want the same thing. There's no question about that. So do we put in another grant to NAPCA to follow up in another year on this, or? You know, it seems to me we should do this again, just to see where we are a year from today.
Go ahead. Wait for you.
We certainly can do that. We certainly can apply for additional funding to follow up on this study. And I think that would be interesting regardless of what happens during the legislative session. Certainly what would be, I believe, most impactful, as what Steve has alluded to, is creating a system that includes this sort of study already embedded in it, and what happens in our bars and restaurants currently is minor decoy operations, because we have the statutory authority and funding from the legislature to do that, which we currently do not have for alcohol home delivery through third-party providers.
I think stakeholder feedback will be important, because the regulated industry is regulated. I mean, they are, and nobody wants people that are cutting corners when you're following all those rules. And so I think just make sure you're in contact with the stakeholders, because they're the ones that are going to be dealing with it and getting it fixed. That'd be my only thought on it. And there are like responsibility.org, NAPCA, the groups that work closely with industry and regulators. They want this addressed. So yeah, good information, but I think there's some of it that is beyond our pay grade, so to speak. It's legislation, and I think now we know what some of the regulated industry knew 2-3 years ago, and why they were advocating for this. They saw this storm coming, but
so before we leave this, what's our next step?
We hope to advance legislation and with the legislature and discuss and have a discussion with them about, you know, what steps, how far the state of Oregon is going to go down the line to provide additional regulatory oversight. I think a part of that, just because it's not all there yet, and who does the work and how do you get the industry standards on the different ways they are verifying ID and what we know about them and how good they are. Because you can imagine there'd be the digital equivalent of a fake ID, right? There's plenty of companies that would develop, you know, hacked software that folks could use.
So are you talking about penalty, increase of penalties? Is that what we're gonna be getting at?
Not necessarily an increase in penalty, a change from what would be a criminal penalty. You know, if we happen to be at the door and caught them, or if there was a complaint with evidence, you know, we had the Ring doorbell video from a home delivery that we knew about, could find. You know, but the reality is on the doorstep, regulators not gonna be catching very many of this. They're gonna come because of the complaint, because of the record keeping we have. So the best advance I think that people are looking at in the country is get better versions of IDing the buyer and the purchaser that you're delivering to, and understand that nature of that delivery happening. That could be direct, you can't drop it off, there can be consequences in law related to that. The part that is difficult for me right now to say, oh yeah, this is the kind of technology that's working and everyone should use it, or what the standards are, or how we know the databases that they check that with, how closely those are tied to government, you know, transportation databases, to make sure that they know that that person they're delivering to that made the purchase through their phone, that has your digital version of you that they also have, the delivery person can have your picture, your ID, your number right there with them and the delivery. So it's checking the box and making sure that works. No one has prescribed what that best practice might be on that. And I want to be really clear that, and we do this because we still have a standard in law. You got to check the physical ID. Can't be a verified, even if all the data is right, it's backward, not a verified one. I want to be really clear. This discussion right now that we're talking about is not about the real ID that the federal government and states are doing. This is really about how do you make sure that that official ID is verified completely, maybe inspected or inspected in some way digitally that's of consequence enough that we understand that the person making the purchase through the is the one receiving it at the door, and that person delivering it has the technology in their hands to verify it.
So I have a question. What percentage of total alcohol sales in this state are home delivered?
A very low.
I would
Who's
assume, what, are we talking about 1%?
No, I think
Probably.
we're talking about more. We'll have to get back to you, Mr. Chair, but because beer and wine has been delivered for some time, right? Distilled spirits have only been delivered through our
The cocktail.
distillery outlets and cocktails to go. So I have not seen the combined data, especially post-COVID.
So what, give me a guess.
I don't even want to venture a guess because I really don't know the beer and wine side well enough.
Chris, you got a guess?
On the spirit side, it's 1%. On the beer and wine side, I would only be guessing, and I'm maybe 9%.
Yeah.
9?
It's growing rapidly.
That
You know,
high?
beers-
But most of those are to licensees, they're not
Correct.
to like residential households.
Yeah, I'm-
Right. It's
I
either.
want to know the residential
No,
house.
yeah,
The
no.
question is on the residential side. So it's
Yeah.
much lower than that,
So DTC,
right?
I would under 5. Maybe even under 3, but I'm just guessing. I don't have the data.
But you think about how rapidly it's growing, and every grocer, right, and you saw, I think the picture there, right? Every grocer might have 6-pack of beer or a bottle of wine inside it now, and that's becoming very common, right? Growing rapidly. So,
Well, if God forbid there was ever privatization in this state, that would become a very, very big issue, I would imagine.
private states, open states and control states both have this problem. They both
But to a much greater extent.
Yeah, well, especially when you got multiple locations and I mean, we have the same nature, of the open system for beer and wine essentially, right? So that's pretty prolific throughout.
Well, bottom line, Steve, I think we need to, in order to enforce this, in order to have some accountability, I think these guys need to be part of our system. We need to get them part of the system. Otherwise, there's no enforcement. know, it's a criminal. It's not, we can't enforce, there's no penalties. It's criminal right now. But we have to get them in the fold.
We're working towards that aim to give you ideas for the commission to look at, to work with the legislature on those ideas with industry and with, national partners in that regulatory side. Virginia's just done some interesting regulation on this. Other states have. Tyler, Jessica, doing a lot of research about this, and certainly Julia's research and interest nationwide on what we're doing here is going to help inform the discussion, right?
Well,
It's getting better. I'm glad it's at that point where I think it's very actionable for the states to begin to take steps to make the delivery system accountable to the regulators, and accountable to licensees that need them to do it right?
Jessica and Julia, will you do me a favor and over the next 2-3 months, as this thing develops, will you consider what kind of information you can develop that would necessitate another NAPCA study in terms of where we're going with this thing and what we can accomplish? Because I'm pretty sure we can get the money for that.
Yeah, absolutely. Absolutely. We can put our heads together, and Julia, as I noted, is nationwide and probably internationally renowned researcher. So I'm sure that won't be hard.
Well, what I want to do is not hash over the same stuff again. I want to understand what the next level is, both on a national, as we say, this is a state, but it's also a national problem. So let's get the funding to figure out what we can do. I don't want to go over the same thing again.
No, our regulated industry partners have said repeatedly, they are there. They're there to help. They're there to make sure, because again, like it's the responsible sale and the distribution of alcohol is the primary responsibility of these folks. They want it done the right way. So keep them involved in the conversation too. And there's a lot of those resources out there, because nobody wants this, craziness. But in a sense, it's a wave that hit us. I mean, and what you didn't mention is COVID. There was so much stuff that changed with that. And a lot of those discussions were going on prior to everything that happened with that. So just keep folks informed, all our licensees, because nobody wants the system to change. So it's just, let's just keep it in touch with everybody. And good job.
And Mr. Chairman, I just got a suggestion, because I know these third-party delivery companies are very diligent in trying to do their work right. They'd be happy to come here and talk with the different companies about what they do, how they track it, what training they provide, and how it comes to. Thing is, we don't get any of that information, right? And that's part of the
but
process.
Steve, when you say that they're very diligent, I mean, you've got to be deaf, dumb, and blind not to understand when you read this report that there's need for improvement. The 2% that they just drop it off at the door is unacceptable. The people who don't ask for IDs is unacceptable. When you read this thing, if you're a government organization, you put it on the shelf, that's one thing. If you're a private organization, you read this, you come to the conclusion that there has to be, where do you get away from the fact that there has to be more penalties is the only thing that puts somebody on notice that they got to do this right, or they face a problem. Then we have another problem, is you can have all the laws on the book. If they're not enforced, then who the hell gives a damn about it one way or another?
One thing, like, server education, Kiana knows as well, it's you go in, back in the old days, they used to go in person, you get your server's license, you go through a course. I mean, you are trained in the responsible sale and service of alcohol. And anybody that's held a license understands, how important it is, like, what we're dealing with in this industry. It's not just about, because this is a unique industry. And so I think in some ways, when I see those numbers, those folks at the door have never been trained in that. Like, so the fact of it is, they're just sort of, the fact that compliance is even at the level that it's at, where before they were just delivering food and now they are delivering alcohol as well, yet they've never been trained, they've never been permitted for that. They're just taking it upon themselves in a sense. So it speaks to what the industry said several years ago, that this is a coming issue, but there's a lot of stakeholders in it. And so the less you sort of spring on them unsuspectedly, the more they're going to be engaged in the conversation and coming up with solutions versus being caught off guard. It is my only thought on it, because we all want to address the issue, and everybody that's conducting business at that level is competent, smart business entity. You just got to make sure that they're properly informed and we're all marching in the same direction on this stuff. So that'd be my only thought.
Well, unless somebody tells me otherwise, we're here, this body's here to protect the public, okay? That's the only reason we're sitting up here. Here is a classic example of something we can do to protect the public. So maybe one of the smart things to do is to go back to NAPCA and ask for money to develop maybe a course or something, and a training course that can be done on a national basis to Matt's point.
Let me do this at a couple points. One, there is some training that occurs that we know and understand that's available. We already do training for those clerks that sell physically in grocery stores, right? That's training on what ID verification, train so they don't sell to minors. It's training on not to sell to intoxicants, to intoxicated persons. That's one thing. The other part is for this home delivery, many of them do have training. It could be a business that's licensed and has a server permit that's making the delivery. It could be from the establishment itself. So everything's not wholesale. They don't have training at the door. Some of that, though, is very much a concern of what the level of training is for those employees or contractors making deliveries at the door. So one, we have standards. The legislature and law and us under our rules have in place some standards for training. What we haven't really done is in the opening world that we're not controlling, where more deliveries are allowed, making sure we understand who's delivering and can enforce who's delivering out there.
That's the part, yeah.
Yeah.
Chair Rosenbaum,
Commissioner?
Yeah.
right here, what we have to take a look at is Steve and our own legislative committee here needs to formulate law changes. Because right now, we could give them all the training that we say we think they should have. But if we don't control them, they're not under our jurisdiction. They don't have to comply. So I think probably the next thing is as you know, and our plate is already full, the session hasn't even started yet, is that at some point we need to have a change in law that gives us authority to work with these providers.
But this is such an important issue in some ways that it should go, in my opinion, it should go as a priority. I mean, this is a protection of the public issue. If people are concerned about alcohol getting to the hands of minors, I mean, they look to this commission as a vehicle to protect people in this state. And we need to follow through on that. I mean, this is one of the areas we can follow through on that, right? I mean.
Absolutely. I'll just note, you're still falling through on the physical deliveries where our stats are not very good post-COVID for minor decoy operations. We're still got a higher failure rate than what we used to have prior to COVID. We are continuing those operations and will until we get the rate up. But that may be something where you look just internally at the physical deliveries and what our penalties may be in the future if we don't see sort of this post-COVID normalization of making sure people check the IDs and make legal sales and do not sell to minors.
Well, for this report, We should do better and we can do better.
For sure.
And we need to do better. Thank you.
Thanks, Jessica.
Thank you.
We'll see, and please keep in mind, from the results of the conversation this morning, what a follow-up study would look like and what we need to do on it.
Absolutely. Thank you all so much, commissioners. We appreciate your time this morning.
Thank you.
Report. Thank you.
Good
Thank
report.
you.
I'm gonna get a cup
Yeah.
of coffee. I
Thank
don't
you,
know if
Jeff.
anybody wants one, but I do.
When they capture digital ID, do they save those digital IDs?
Yes.
So how do you protect the?
This is what we can get a lot of discussion here.
Next is the role of the Oregon Cannabis Commission in the cannabis regulatory structure. Dr. Anthony Taylor, Chair of OCC. Good morning.
Good morning.
Good morning.
Commissioners, Director Marks, Commissioner Melides, it's nice to see you again. It's been some time.
Yeah.
Been some time since I've been in the building. So, my name for the record is Anthony Taylor. I'm the Chair of the Oregon Cannabis Commission. Just a brief background about me. I've been a cannabis reform activist since the late '70s. And I'm also the co-founder and legislative director for Compassionate Oregon, which is an Oregon nonprofit organization dedicated to advocating for cannabis patients and cannabis in healthcare. And it was through the our efforts that the Oregon Cannabis Commission was established. And it was established in a sense to make sure that patients didn't get run over in the rush to green and legalization. And so we fear that, we just kind of get lost in the shuffle. And we also feared that, the existing OHA medical only dispensaries and the whole network of growers and processors would be overtaken by the regulatory structure of adult use, because the sunsetting of limited sales to adult users sunsetted at the end of 2016 and really kind of forced all those OHA medical only dispensaries, some 540 of them at the time, into the OLCC system. And now we have, I believe, one Oregon Health Authority medical only dispensary. We have no processors and no dispensaries. So it's been an interesting landscape for patients. The OCC is really the only bridge between the regulators and the patients at this time. And that has been our focus, is to make sure that patients are have a voice within the regulatory structure. So next slide, please. So I want to provide an overview of what the OCC is and what its role is in cannabis regulation, what we've accomplished in our first 4 years, and what we look forward to accomplishing in the future. The commission, bear with me just 1 second here. Next slide, please. So the commission consists of the public health officer or their designee, a registry identification card holder, which is I hold, a person designated to produce marijuana by a card holder. That seat is currently vacant. An attending physician or provider, these are folks that sign an attending provider statement to authorize the OHA to issue a card. That seat is also vacant. Person representing the Oregon Health Authority, currently Andre Uso is that person. Person representing this commission, and that is Amanda Bora at this time. A local health officer, Dr. Patrick Ludke out of Lane County, a law enforcement officer, George Burke out of Salem, and then a person knowledgeable about research proposals and grant protocols, and that is currently held by Dr. Edie Ray, who is also the vice chair. The Cannabis Commission has also established standing committees to facilitate the commission's work and goals. They are the Research Leadership Subcommittee, Governance Framework Subcommittee, and Patient and Health Equity Subcommittee. These are the experts on cannabis in Oregon. So our role is to provide advice to the Oregon Health Authority and to the Oregon Liquor and Cannabis Commission in matters relating to cannabis as medicine. We are also tasked with developing a long-term strategic plan to ensure that cannabis remains a therapeutic option for patients with debilitating conditions and that it remains affordable. We are also required to study and monitor federal laws on cannabis. The original language contained in the legislation that was passed and signed into law in 2017 required a strong research component, including steps that the state must take, whether administrative or legislative in nature, to ensure that research on cannabis and cannabis-derived products is being conducted for public purposes, including the advancement of public health policy and public safety policy, agronomic and horticultural business practices, medical and pharmacopoeial best practices. We were also instructed to determine a possible governance framework for the OMMP, considering potential factors that could prevent access to cannabis for medical use, potential laws and rules that will facilitate access for cannabis for medical use, the impact of federal laws, regulations, and policies on the possible frameworks, and potential factors that could prevent access to cannabis for medical use. I'm repeating myself, apologies. This section also provided for the OCC to work with interim chairs of health and judiciary to direct legislative counsel to prepare legislative concepts for the commission's consideration. This part of the original legislation sunsetted in January of 2021, and we have been trying to get that part reestablished. And in 2020, we had legislation that would have done that. And the legislature is still sympathetic to reestablishing that ability to work with the interim committees. We are in an interesting place as the advisory committee to both the OHA and this commission that this gave us the ability to work with the legislature rather than having to tailor our recommendations and proposals such that they would fit into an OLCC or OHA legislative packet. And we really look for, we have been and will continue to work with the interim chairs of House and Health and Judiciary, and hope to get language reinstated to make that part of the legislation. Next slide, please. In January of 2019, the Oregon Cannabis Commission submitted their report to the legislature containing 11 recommendations to improve cannabis access for patients. Among other things, our first recommendation, of course, in that report, and it continues to be the top of our focus, is establishing a stable funding source for the medical marijuana program. Currently, it's a fee-based program, and that puts the onus of supporting the administrative costs on the backs of the patients. And 60% of the medical marijuana patients registered with the state in this state are low-income individuals and qualify for the reduced fee cards for the OMMP. And some of those are, if you qualify for the Oregon Health Plan, SNAP benefits, SSI, or a veteran, you get a reduced fee. And those range from $20 for a veteran and SSI to $60 for someone that's on receiving SNAP benefits. So in our report, again, the main focus was establishing a stable funding source. And then we also recommended that there be an overarching body to oversee cannabis writ large, so that agencies weren't making decisions that affected how cannabis was treated by the other agencies. We also we thought that the siloed approach to regulating cannabis was falling a little bit short in addressing some of the concerns that patients were having, and wanted to make sure that one agency didn't do something that affected those patients adversely. And actually in statute, the OLCC is, as part of the construction, is not supposed to be doing anything that affects cannabis patients or the OMMP statutes. In July of 2020, we adopted working priority guidelines, and this outlines the proposed changes to the regulatory structure, creating that overarching body to oversee everyone. When you look at cannabis from a higher elevation, from the 30 or 50,000 foot level, you begin to recognize that cannabis as medicine touches nearly every agency in the state. And that the work that this commission does in regulating adult use access is simply a spoke in a wheel, as OHA is in overseeing the cannabis patients, as is the Department of Ag, who oversees hemp. But we haven't gotten there yet, but in 2021, when we passed House Bill 3000 and created the task force on cannabis derived products, that got really close. There are a lot of folks on that task force, and they got a chance to kick things around, and they've come up with some good recommendations. And one of those recommendations was in our first report, and continues to be something we're advocating for, is the creation of a state reference lab to oversee the cannabis testing sector.
Say that again, I'm sorry.
We are advocating for a state reference lab to oversee the cannabis testing sector. There are a lot of concerns. There are a number of concerns about the testing, of course, that we want to address, and we brought that forth in almost 4 years ago now, and we're going to continue to advocate for it. I know this commission, Director March, is working to create some funding and working with ODA to get it off the ground. And I think this session is going to be the session that actually happens. So the task force on cannabis derived additives also recommends that we create a state reference lab. And the research subcommittee of the Cannabis Commission has drafted and sent a letter, and I believe that's in your packet, that you may have already received. If you have not, you'll receive it, which includes our letter recommending a letter with our recommendations for a state reference lab, and what the commission thinks is what we need to accomplish when we do get that up and running, creating standards and practices, making sure that the ability to pull products off the shelf and make sure that they are what they say they are, which would add to the ability for the recall process that's already in place for products that we just had a recall, I believe, that will add to that process and give it a little more strength there. So the Cannabis Commission has been working diligently since the report was released, and in last year, January of last year, we sent another letter to Director Allen, the OHA, and Director Marks here, reiterating those recommendations and following up with other recommendations for make sure that patients were receiving quality product. You know, a lot of times when you go into stores these days, they're really kind of cookie cutter. All looks pretty much the same, which is okay for familiarity. You go in, you know what you're seeing, you know where the candy bars are kept in 7-Eleven, right? So they all kind of look the same, you know what you're looking for and usually where to find it. We would encourage all the retail licensees to continue to have a distinct separate section for cannabis patients so that they see what's available. Some of the stores in the licensing process, stores have the opportunity to declare themselves as a medical grade dispensary or non-medical grade. That allows them to sell the higher potency products for the cannabis patients. Cannabis patients are allowed higher possession limits for flower and for some of the extracts and concentrates. For instance, a non-patient can purchase a 1,000 milligram cartridge, and a patient can purchase a 4,000 milligram cartridge. Those are not
Can I
available.
ask you one question? I forgive my ignorance on this, but I don't mind asking questions that I don't know about.
I don't mind answering it.
When you say that they're allowed to purchase a higher, like 1,000 milligrams or whatever it is that in a regular store or is that just at the marijuana medicals?
No, there are only one medical dispensary
Right.
left in the state. These are your OLCC licensed retail outlets.
So,
Yes,
so a person with a medical marijuana license would be able to go in the store and buy a higher percentage than other
Correct.
people would.
that's correct.
So,
For instance, the edibles. For a non-patient, they used to be limited to 50 milligrams per package. We recently raised that to 100 milligrams per package, which is the same for a patient. However, patients really were working to raise those limits as well, because if a patient is recommended by their care provider that they should be doing 250 or 500 milligrams of an edible every day, they have to go in and buy 5 packages to get there. So we're trying to work through that to figure out how we can make those more readily available.
the reason I asked you that question is that there really isn't only one store. All the other stores cater to the patient as well.
That's correct. And we,
That's important for me to get in my head, okay? I have to understand that. Okay,
sure. And in those stores, patients do not pay the taxes on their purchases.
Right, that I know.
Purchases.
but
So, let's see, where was I? So anyway, we're trying to work through those issues so that the patients have higher possession limits than the non-patients. Right now, it's an ounce of concentrates or an ounce of extracts for a patient or non-patient. And in many instances, a patient needs higher possession limits because they want to go to the store one time and get enough for the month. Right. So we're going to work through those with Director Marks, and he's been very patient with us about that. So and I'm willing to work through that. So let's go into the next slide.
I don't understand.
So here's where we're talking about the state reference lab. We submitted letters to the stakeholders outlining our concerns and recommendations for the reference lab to oversee the commercial testing of cannabis and establish guidelines for product assurance and improve recall protocol for cannabis products. We also want to make sure that, and one of our recommendations coming out of the commission here shortly is to create electronic access to all product information. So that when you walk into a store and you're unsure, you hit a QR code, it has a FAQ menu. It has information about the difference between cannabis and CBD, or THC and CBD. It has a reference for health professional counsel. So if you have questions health related, you can get in contact with the nurse hotline, those sorts of things. So that, and then Also available would be the certificates of analysis, because for patients, what's in a flower is important. The terpenes, the phytochemicals, those issues, the THC levels, not that important to a patient. And in fact, the marketplace has put an undue influence on the level of THC in a product. And right now, if you're a producer trying to get your product into a store, if it's not 20% THC, it's the likelihood of you being able to get it into a store is slim. Stores are looking for products that are in the 20 to 32% range THC. And frankly, in the old cannabis culture, THC wasn't really an issue. When a person back in the 70s would go to their dealer, they'd look at what the dealer had, say, yeah, too much steps and speeds, and go to the next guy. But they
We're all
would,
laughing because we.
but they would smell it first. And then they look at it, and in those days, you'd try a little bit of it, and if you were satisfied, you'd make your purchase and move on. These days, it's kind of cookie cutter, and if you want to smell the cannabis, the counter personnel has to hold the jar for you and things of this nature, and you certainly can't try it in the stores. For legitimate reasons, of course, but that's not the way the culture used to work. And my experience has been that when you go into the retail shops, not only do they all look the same, but most of the weed smells the same, tastes the same, those sorts of things, and you can't.
Mr. Taylor, I'm sorry to cut you off, but I need to ask some questions because I was back in the day.
Go ahead.
Not all of us agree on anything until we've had a chance to meet. My questions to you is, I have several questions. One of the points you make is about your interest in having therapeutic options. What research organizations is this organization working with across America to actually, I'm going to say that because I said it 8 years ago, to have actual scientific proof about what marijuana specifically will do to treat industry, not anecdotal. Are you working with any Mississippi State, Oregon State University, University of Kansas, University of Missouri?
The Cannabis Commission itself is not. Our chair, Dr. A.D. Ray, is a NIDA-funded cannabis researcher who works for Legacy. And she is pretty much on top of that sort of stuff. And one of the recommendations we have made for the OHA to update their public health statements about cannabis is to go to Canada or go to Colorado and look what they've done.
I don't want to go to Canada. I don't want to go to Stockholm. I don't want to go to Africa. So the organization itself is not working with any research institutions in America at this point.
That's a tricky question.
I'm a tricky guy. I used to be an undercover.
I appreciate it.
I'm very tricky.
The state of research in cannabis in this country for the last 50 years has been abysmal.
Mhm.
And in order to get clarification for research, you have to get through NIDA, NIH, and the DEA. And the roadblocks that the DEA set up specifically make research for cannabis really hard. So there really aren't any organizations doing cannabis research. There's cannabis research being done here at Oregon State, OHSU, the VA, Legacy, as I just mentioned, but they're not tied into any real network in Oregon. And that's what we're trying to establish also, this reference lab and the research library that needs to go along with it. Is this network of cannabis researchers in Oregon so they can start talking to themselves, so we can start to develop a framework that allows us to do the research to determine what potency or what dosage a person.
But you're then asking the state to create a system that's going to fund your organization.
I'm sorry, One more time.
Or you're asking for legislation to essentially fund the administrative operation of the organization?
Of the Oregon Medical Marijuana Program, and along with that, we're also asking for funding to create research pool funding, so that there's some cannabis, there's some revenue available for somebody to apply to get $20,000, $30,000, $40,000 to do their initial study, to apply for the $3 or $4 million at the federal level.
So then you're also then asking, and you're right, it is very good, because I was at that 40,000 feet with Commissioner Validas for a very long time. And so at 40,000 feet, we're looking down and we said, we need to have limits on potency. Because the medical marijuana community came to us and said, don't tell us what to put in our candy. Don't tell us what to put in our cookies. Don't tell us, don't tell us, don't tell us. So here we are. You're saying that the cookie cutter approach to what my view of public safety is basically inappropriate for your clientele. How do we address that when it doesn't appear that you want your patients to be under our jurisdiction?
Well, what we'd like to see is regional distribution centers for patients. So that when a patient needs 500 milligram suppository for 30 days, or whether they need a pound and a half or 2 pounds of plant material to produce a topical or a tincture, that they're able to do that, and that there's a delivery system, distribution system, so that when a patient calls up, kind of the Amazon of medical cannabis, they place their order and it gets delivered to them within a reasonable time. And once we reach that, that begins to ease some of those issues in the stores, where stores aren't carrying the product because they don't move. You know, there's only a couple of people that come in and buy transdermal patch.
So let me get this straight. You just said they have a product in their store that doesn't move, takes up shelf space. I get those phone calls about going out of business because you didn't regulate us enough at this point. So you want that business person to hold on to a product that doesn't sell and takes up space on the shelf to satisfy your clientele.
That would be nice, but the market doesn't allow it. And that's why we would like to see a regional distribution system set up so that these products are available to patients, because they're not available now.
At whose expense?
Pardon me?
At whose expense?
The overarching sense of who's paying for this from the Cannabis Commission is that it comes from retail tax revenue, but this state has got it upside down and has never funded any of the medical marijuana program expenses, no efforts to fund research. And that's what we're asking for, is that we expand what we're doing with cannabis so that we know better what we're doing with cannabis.
So, and so additional revenue dispersed from what the ballot measure said the money should go to, you want it reallocated to a certain degree?
To a certain degree, yes, sir. And our recommendation, frankly, is that we have continuously appropriated funds that allow for the administrative costs of the medical cannabis program in this state, and to create cannabis research funding, and to create a pool of money for cannabis innovation as well.
Excuse me. Has Dr. Ray been successful in obtaining grants or grant writers for research?
Yes. As I said, she's NIDA funded in her cannabis research. And then the other thing is that the commission here oversees the research certificate for cannabis in the state.
Mhm.
And OHSU, OSU, Legacy, VA, they don't have one of those licenses, one of those certificates. They have other, they have to go through other protocol, other procedures, other requirements to get their funding to be able to do it. What the research certificate here does is it allows anyone doing research to interface with the licensee. So if they need some cannabis, they can do that. But it's expensive. It's $4,000 for a 3-year certificate. And one of our recommendations coming up is that we work with the LLCC, and Director Marks was at one of our commission meetings sitting in for Commissioner Borup at the time, and we discussed this about, really fixing this so that people that are doing research don't have this huge cost factor to get certified, and that it moves from OLCC over into OHA so that they have the experts be able to determine if a request for grant money or research certificate is appropriate and has met all the requirements that they set forth. But right now, you can get a cannabis research certificate through this commission. And you can interface with all the licensees, but you're prohibited from transferring some product to a research participant. So you can, get product from a retailer or producer if you want, or a processor, but you can't give it to a study participant. So those are some of the things that I think we can work through fairly easily and begin to, because people that are doing cannabis research in the state really aren't talking to each other because they don't know who they are.
Do you know who they are? Do you have a
Pardon?
database on who those people are?
I'm sorry, one more.
Do you have the data person, sorry, losing my, do you have access to the database of those people who have the information and who are not talking to one another?
We don't.
Who does?
Nobody.
Well, but between Dr. Ray and Dr. Knox, you don't think that all those folks know each other? To me, it seems like they're a pretty tight community of folks that are doing the research and they're all talking to each other. Maybe not at our level, but in a sense, that's not what this agency does, So, my experience, they're all talking. Maybe I'm wrong, but.
Yeah, they're not talking as much as they like to. The people that are active in the cannabis community are talking to each other and know what each other is doing. But there's not a lot of research going on there. And the ones that are doing the research, like Dr. Chu, who's the original chair of the Cannabis Commission, doing research up at OHSU, she doesn't know many people that are in the circle. They're not connected, and we'd like to keep people connected.
But do you think that's kind of on them? And I'm just saying, we could want one hand, but essentially it's how would we facilitate that?
Well, supporting our recommendations for the reference lab and the research library and building of the network around it.
Yeah. Okay, makes sense.
We really feel strongly that the reference lab is gonna provide a lot of help to things, and because there's instances, to get to 20-30% THC, some of the growers are adulterating product. Some of the vendors, the wholesalers, rather than using the 21% plus or minus 4, they go, oh, this is 25% product. Those are the sorts of things that a reference lab and some oversight over these labs would certainly help, because patients depend on the package holding what it says.
Right. No, we just we just took action on that last month, and this agency takes that seriously, and in a sense, that's dealt with the tools that we had. But you're right, Steve's said it for years, the reference lab, so I think yeah, I think we're on the same page generally, just, and just to go this one, I'm up here talking, a couple things, a lot of the stuff with the medical stuff, and, we all want the patients to have what they need. How much of this, though, is, you talk about the funding for the medical stuff, and if you want it to be treated as medicine, how much of this discussion has been had with whether it's Oregon Health Plan or the insurance companies? Because, OLCC, sometimes when you ask this agency to do stuff, like, there's only so many tools that it has, and its core competency isn't always what I think sometimes the industry wants it to be. So whether it's these sort of new approaches to things or kind of reinventing the wheel, it's I'll just being honest, and as much as I care about and respect the agency, there's only so much this agency can really do. Like, how much of the discussions on funding this program have you had with like insurance companies? I mean, like, that's how medicine is essentially acquired and funded in any normal sense. Like, an insurance company will pay for people's medicine. Have you had discussions with anything like that, or looked at that at all?
We have, and there are some states that are now allowing a patient to pay for their cannabis with a health savings account card. Things of that nature are starting to work through. It's still a cash only thing, and the insurance folks, it's federally illegal, and they always fall back on that.
Yeah.
And so it makes it difficult to make any of these advances, especially for people using cannabis as therapeutic benefit. And while the state requires that cannabis be treated as a medicine, the OHA only considers the medical marijuana program a registry program that registers patients and allows them to use cannabis medicinally and have higher possession limits for flower. But it doesn't address their issues in trying to get a home or rent a house and be able to use cannabis. It requires a patient that's growing their 6 plants in a rented home to get permission from the landlord, but not the non-patient that's growing their 4 plants.
Yeah.
The state requires a patient that's growing their 6 plants to register their address with the state as a designated grow site, but not the non-patients that are growing their 4 plants. So we're struggling for parity here.
Yeah.
And we're struggling to get our civil rights back because we're told that you can't use cannabis in a rented property. It's like saying, well, you might as well leave your insulin at the door.
Mm-hmm. Yeah.
These medications, I know it sounds weird to think about cannabis and marijuana as medicine, but it is medicine.
Yeah.
It's always been medicine. And it's tough for patients to get bandwidth because the healthcare sector won't recognize it. We have doctors out there that refuse to prescribe appropriate medications to patients when they need it.
Yeah.
We have doctors that refuse to prescribe opioids when they know a person's using cannabis. We have organizations here that won't let cannabis patients get a kidney if they need one without jumping through a bunch of hoops, without stopping using their cannabis. Oh, you're using it for pain. We're happy to give you as many opioids as you need. So patients struggle to get bandwidth, and the healthcare community is not listening. The Oregon Medical Board goes after doctors that are signing cards for minor patients. The Oregon State Board of Nursing had a gag order on their website saying that nurses couldn't talk to patients about cannabis. In 2021, we managed to expand the list of people that could sign an APS card for these patients to include not just expanded it from MDs and DOs to include naturopaths, physicians assistants, nurse practitioners, nurse anesthesiologists. And these folks are protected in doing this. They're protected in writing these recommendations. They're protected in having conversations. They're protected in administering cannabis to a patient, and they're protected in their own use of medical cannabis in the state. in this state, a patient has the ability to designate an assisted living facility as their caregiver, but they won't do it because it's federally illegal, and they're all worried about losing their Medicaid reimbursement. So it's a tough landscape out there for patients. And I know I've diverted a little bit away from my slides, and I'd like to get back to it, but it can't be emphasized enough that the retail marketplace is not working for patients.
I think,
Now, it's because for patients, it's not just about going to the store and getting what you need.
I think
Because
that
if you're using 2 grams of oil a week and it's costing you $20 a gram for oil, that's $40 a week. That's a couple of $1,000s a year. These costs are not subsidized, and again, 60% of our patients are low income. So we have to find some middle ground whereby some of these costs for qualifying patients can be subsidized.
yeah, and I hear you.
And not just the cost of the products, but the cost of the services for testing and processing. You know, some of these patients that are growing their own product, they want to know how much THC or CBD are in their product, or they want to know that it's been, oversprayed from a seed field, but it costs $350 for a complete panel, and somebody that's, on a limited income doesn't have the resources. For myself, I make a cannabis infused product. And I'm not the person that wants to make that product and then just see how it works. I want to know what I'm taking, so I take it and get tested. And over the first year or so, I determined that my process, if I followed it, would turn out a 15 milligram product every day. So
Yeah, I think, just again, it kind of comes down to the traditional funding sources, and we don't maybe want to get too outside of it, like you're talking about charity or talking about insurance in my mind. And so like you might, a lot of it and you need federal legalization to change, because so much of it, a lot of your frustrations that I'm hearing are systemic. And I don't know until you unwind some of that stuff at the federal level or until you get a funding source. But you got to you probably know as well as anybody how thin the profits are at the retail stores. Folks aren't making money. It's not like they're trying not to help patients. They just don't have the money to do it. And so, one thing I would, we could talk about it more, but I think that the more you can plug into the existing system versus fighting it and figure out a way to facilitate what the folks need is, you're going to be doing yourself and everybody a favor, I think, in my thought. But that's just,
Well, that is what the commission is trying to do, reach out to these folks and to work with the Oregon Health Authority and updating their public health statements relating to marijuana, cannabis. And we're hoping that some of the work we do spreads out and begins to organically affect some of these issues. Being able to talk to your doctor about cannabis, having open and honest conversations with your healthcare providers is just key for a lot of these patients. And a lot of the patients are almost afraid to do that. I'm fortunate, I'm a veteran, so I'm in the VA healthcare system, and I'm cannabis, and they don't have an issue with it. And in fact, their statements have said using cannabis will not in any way have a detrimental effect on your benefits. So at the federal level, and I really, I take issue a little bit with the argument about it's illegal federally. In 2014, this state, the citizens of this state said, we don't like what the feds do, and we're throwing it off. And this state, I think, needs to continue that progressive approach and say, we're going to take this step. We're going to make sure that the 30% of our medical marijuana patients that are also Oregon health plan patients are put together. Because right now, the Oregon health plan policies is we don't sign cards. So this person is in a low income, a program designed for low income Oregonians has to go outside their program to a cannabis doctor with $150 to $200 to get their card signed.
Right.
So these are the sorts of things that we're trying to accomplish. and move forward so that patients in general get their rights back. And frankly, Oregon, cannabis is not even on Oregon's list of controlled substances. So we have all kinds of doors that are almost open that we need to push further open so that patients have a better footing, so that they don't have to worry about
That's why.
being drug tested and losing their job or their educational access to programs because they tested positive for THC.
Well, that's where I think that the research comes in strong. It's not gonna be quick, but it will be a really important foundational argument for you. And I think that, like, I know you were stating that Dr. Ray and Dr. Chu and all these other doctors, scientists, they're doing research and you know of them, but perhaps having a difficulty with them, everyone knowing one another. But in this digital age, you know, I know scientists and doctors that are collaborating all over the world. And I think that perhaps if you have the authority or the desire, perhaps maybe approach Dr. Ray about initiating or spearheading some kind of a collaborative process that will be supporting to your goal.
Well, she has done that as the chair of the research subcommittee and is moving in that direction. That's why she wants to get the cannabis reference or cannabis reference library started so that some of these folks have access to the data that's already being produced and start to get to know one another a lot better.
Yeah, how much more is your report on the?
I can move through it pretty quickly.
Okay.
So next slide. So this is what happens in stores. You folks, I'm sure are already familiar with this. We're taxed 17% state, 3% local. Purchases for non-patients are anonymous and allows for multiple purchases per day. And non-patient may purchase up to statutory possession limits with each visit. OMP card holders purchases are exempt, tax exempt. The retailer is required to enter your OMP number. This identifies the purchase as tax exempt. They purchase up to the statutory possession limits with each visit, except for flour. The statutory limit for flour is 24 ounces. The state only allows an 8-ounce per day purchase. And since our purchases are tracked, it's really easy to tell if we've been into a store a second time or another store down the line to make another purchase. And this was frankly, how many years was that when we dropped the purchase limit for patients on flour?
2018.
That was 4 years ago or something. And what sparked that was data coming back from metric reporting that showed anomalies where couple of patients in a store were coming in and purchasing more than they were allowed to purchase on a daily basis. So that was why there was some limits put on possession purchases for flour. And then all the rest of the cannabis, the extracts, all those, the possession limits are all the same. Next slide. So here's how we stand in the retail market. The cannabis patients are spending between 50 and $70 million.
That was a question I had.
And since 2017, these patients have spent almost $500 million in the stores. State's not making any money off of it, and the stores are, of course, but when you look at a number like in 2021, the 2020 and 2021 numbers are really inflated because of COVID. But when you look at the fact that 20,000 patients in the state purchased $100 million worth of cannabis and cannabis products, that's too much. We've got to kind of figure out how to reduce or subsidize these costs, at least for qualifying patients and patients that receive reduced card fees and low income and are on OHP and get SNAP. The OLCC does a really good job on getting the information out, the statistics, and that's where I got these. As you can see, it's from the harvest price and sales market data. And as I've noted that there's a breakdown of all the product. You know how much oil, concentrates, edibles, flour being sold to non-patients, but the information is available for patients. It's just not published. I spoke with TJ last week and we had a little discussion about that, and he furnished me with some of the data that's available already. And we're gonna talk more about getting it up on the website.
I got a quick
Next.
question for you.
Yes, ma'am.
Can we go back to that last slide? Medically, during COVID, these numbers are really inflated, really inflated. Why would COVID inflate the medicinal side of things
People were at home not doing anything.
medically, right?
Yeah, well, they needed their product, so they went and got it. There wasn't a lot of people moving around, so there weren't a lot of folks going to growers to get product, which a lot of these do. You know, when you look at these numbers, you have to recognize that some medical patients never go into a dispensary. They can't afford them, or they have other sources. Other patients go in and make tax exempt purchases for non-patients, their friends that want, 2 ounces of Jack Herer and don't want to pay the taxes on it. The other thing is the wholesale price of cannabis has dropped through the floor. You can buy cannabis, top grade cannabis right now in some places from some vendors for less than $1 a gram. That hasn't filtered down to the retail prices yet. So while you can find cannabis for $30, $40, $60 an ounce, you're still seeing some of it at $12, $13, $14 a gram. And for a retailer that's picking up a pound of cannabis for $1,000 and selling it at $14 a gram, at $10 a gram, that's $4,500 a pound. So those reductions in wholesale costs haven't filtered down on some of these products. And also when you go to, buy an extract, some of the products that they use for dabbing, those are $25 to $45 a gram. And so some of our patients that are using the higher potency ones because of the debilitating condition, they can't afford it. So they're not necessarily getting it from the regulated markets, and that's a concern as well. So
Sure, I hear you. It's just when you see these numbers, how can you not think that it medically, it looks like it's more recreationally during 2020 and 2021.
yeah, and it's interesting because most of the purchases by patients are an ounce or less.
But yet, yeah.
But when you're at home and you're still dealing with pain and it can be delivered to you, the use is gonna go up. It went up for alcohol.
Recreationally, right?
No one was using it.
Well, that's true, but alcohol, they don't sell alcohol as medicine. So,
Right. No, I just, something to point out. I thought that was a little interesting.
Those numbers are skewed.
Yeah.
next slide. Oh, what's next for Oregon Cannabis Commission? Again, secure our stable funding for medical cannabis program, research funding and patient services. And we cannot emphasize enough that this really needs to come from retail cannabis revenue. And that's what we look to the commission to, is to help us get that money pulled back out.
Tax allocation you're talking about?
Yep. So 91 created 4 buckets, right? 91 created 4 buckets and did not do any funding for any kind of cannabis. Went to education, drug rehabilitation, law enforcement, one other I don't remember. And then Measure 110 capped those 4 buckets and pushed all the other money into addiction treatment services. Again, not giving anything to cannabis or cannabis research. And in fact, these people that are using this money for Measure 91 and Measure 110 funds, we're having an issue with because they still continue to prohibit cannabis and drug tests for THC. And when the research is beginning to show that cannabis is an exit drug, opioid addiction, we gotta talk. Right? So these are all issues that continue to bubble up in our subcommittees and what we want to work on. We're going to continue our efforts to implement the recommendations from our 2019 report. We're going to support this commission and the Department of Ag in getting a reference lab off the ground, including a centralized repository for the cannabis research data. I'm going to continue to work with the OHA in updating their public health statements relating to cannabis and work with this commission and the OHA, as I mentioned before, about reevaluating the research certificate and how it may better serve the Oregon cannabis research community. Next slide. Establish it. I've mentioned this before. You know, when a person walks into a store, especially if they've never been in one, they're kind of culture shock. Look at all that weed. But they have questions, and we want to establish a system whereby it's easier. One of the things that we have raised concerns with is bud tenders dispensing medical advice. Oh, this will help you sleep. Oh, this will help you with fibromyalgia, or this will help you ... So bud tenders need more education, and what we've recommended is that they tested for their workers permit, right? It's a 5-year permit. I don't think they have to come back every year to get retrained or updated on new stuff. They get bulletins, of course, but you know, bud tenders is retail, and trying to keep bud tenders around is tricky. It's a really high turnover. It's like restaurant workers, you know, it's really high turnover. So we also want to make sure that OMMP growers with multiple patients continue to be protected so that they can provide cannabis for their patients. One thing a lot of folks don't realize is that the medical marijuana program is really kind of it has several parts. One is a registry part where they register the patients and they keep track of them. Then the other part is registering growers and keeping track of what they're doing. But the most important part is those OMMP growers with multiple patients. Those patients have designated these growers to produce cannabis for them. And so they really need to be protected, because a lot of these growers have the heritage strains and develop strains and work with patients individually. So we want to make sure that they continue to be protected and continue to be able to provide for their patients. It is unfortunate that when the state required these growers with 3 or more patients to be reporting into the OLCC CTS metric tracking system. At the time, we had over 4,000 grow sites with 3 or more patients. Today, we have 260. That means thousands of patients have lost access to no-cost cannabis. And there's no way to get it, not these days, unless they know a grower that they're not registered with, or a friend that will give them some cannabis. But nobody wants to grow for patients anymore because it's expensive. There's no market. Medical growers, except in certain instances, can not sell to OLCC stores. They're allowed, if they meet the requirements, to transfer up to 20 pounds a year. But there's not much market out there anymore for medical cannabis patients since the OHA medical only stores went away. We also want to increase possession, dose, and package limits and transfer limits in the
Yeah, we've got, take another 30 seconds and please wrap it up.
All right, so I will do that. I just wanted to thank the commission for giving me the time and opportunity today to discuss this. It's really important that we continue to work together and have the ongoing conversations about these issues. And I look forward to being before the commission again with any developments or any questions that you folks may have or feel like you want to bring us forward again.
I think we've asked you an awful lot of questions and given you more than ample time, which in my opinion was very necessary. This is This is an important issue. This is one that needed to be aired out this morning. The time and effort on both parts are most appreciated. I think you can tell that this commission has got their ears open and their mind working on this. And I can't talk for my good friend, the Commissioner Revelle, but I think his exposure to all these issues for all the years he spent on the commission is maybe a little bit different aspect than from the newer members of the commission and what you lived through compared to what we're listening at now. But you have our attention, you have our concern, and I thank you for this morning. It was very enlightening and I think very productive. And one other thing. Thank you for showing up here in person. Listen, I want to say this. The commission is in business. We're here in this room. And I think I can talk on behalf of the commission is that we appreciate you showing up in person here. Anybody wants to get the hint from that in the future, they can.
Well, I appreciate that, Chair Rosenbaum, and I do apologize for last month. I was really
You're forgiven.
down.
You know, you're forgiven, and thank you. You did a very good presentation this morning. You have our attention.
Thank you, Commissioner.
Okay.
Two quick
Thank
things.
you, folks. Appreciate
Quick
it.
question.
Yeah, great. Yeah, you've been fighting this battle a long time and everybody in the whole thing respects what you do. I just wanted to say really quickly, Amanda Borup on the commission has done a fantastic job. Her and I talk all the time. She's available to all the commissioners. She's really done a good job at kind of bridging the gap between what goes on in your commission and over here. Because I mentioned it to her, Dr. Adi Ray's study came out last month about the stuff we chatted about, the terpenes versus the THC, and it was timely with you being here and with our actions last month. So I would encourage anybody that's listening to this to check out her study. It's very interesting. She's a local gal and serves on the commission. So thank you for being here. I know it's a tough fight. I know there's a lot going on, but you've been through it and we'll all get through it together.
All right, I appreciate that. And I do appreciate Commissioner Borup and her interfacing. She has been a great help to me. Like if I need to talk to somebody here, like TJ last week, she just took me up and she was part of the conversation as well. And I really appreciate her expertise. I met her with Director Marks when she first started all this, and she's been a stalwart advocate all the way through. Thank you.
She's good. She's the best.
Thank you. We're going to take a 5-minute break. Good morning, Amy. This is the cannabis industry report on the 2023 legislative priorities. You're up.
Thank you. Good morning, Chair and Commissioners. My name is Amy Margolis. I'm the Executive Director of the Oregon Cannabis Association, and I'm also an attorney, and I appreciate the opportunity to come and testify today. I feel like I need to, after the closing comment, apologize for not being there in person. I had to come down to Arizona because my father had surgery. But for that, I would 100% be sitting at the table right now in person.
I thank you for recognizing my comments, and we hope your father is as well.
Thank you. I appreciate it. So I want to run through just a few issues where I think the industry is at, our legislative priorities, our regulatory priorities, touch on equity licenses and funding. But I first want to introduce myself to anybody who I've not met on the commission yet. In 2014, I founded the Oregon Cannabis Association, prior obviously to legalization, and we've been working with regulators, agencies, and the state since then. We have hundreds of members across all of the verticals, and we also work with ancillary businesses. In addition, I've been a lawyer for, I'm almost embarrassed to say how long now, about 21 years. And I've been working with cannabis clients that entire time, initially as a criminal defense lawyer. And then I transitioned with this industry in 2012 and 2013 towards the legal, both medical and recreational market. I also.
That was a smart move, by the way.
Well, I am still terribly interested in the criminal justice issues and continue to work on those, and spent time lobbying prior to this for Oregon Criminal Defense Lawyers and Partnership for Safety and Justice. I don't think that it's any secret that the cannabis industry is struggling. We've seen really in every part of the market economic challenges. And I want to thank the agency for taking particular positions as it relates to the moratorium and being open to hearing from the industry about restricting license numbers and how we can kind of move that conversation forward. And we're thankful for that, and we're looking forward to ongoing collaboration on that issue throughout 2023. I will say, and I think there are a number of us who are optimistic about the future of this space. This is obviously a siloed market. Until we have federal legalization, we operate in this kind of quasi capitalistic, quasi contained arena that is really unique to cannabis. So we recognize there's going to be challenges. There's been challenges from the beginning, but I am extremely optimistic about the future of Oregon cannabis. And we're excited to announce some new projects that the OCA is working on that are going to hopefully help move that along. I want to discuss our legislative priorities. And I think you're going to hear from both myself and the CIA that we share some similar priorities. And I hope the commission's takeaway from that is that we really mean it, that these are the issues that are on the minds of the industry, again, across all of the verticals, and that these are the things that are important to kind of continue that economic development, continue that economic progress, continue the destigmatization. I know we have some things that are different, but we do have a lot of things that are similar. The first issue that we're working on is event sales, event consumption, and social consumption. And I think this is a priority that we share. We are very far behind other states when it comes to consumption. Many states now, and I could provide a list of those, but I know the commission is familiar, have some form of permitted consumption. And it's important for Oregon that we catch up with those other states. Even though we're kind of one of the first adopters of legal cannabis, we need to stay competitive. We need to provide safe spaces for consumption. And this would also open up an entire new area for economic development. So our issues are providing safe consumption at events, providing event sales, and providing social consumption spaces. And I hope that the commission will see, now that I've returned, that we intend to take a pragmatic approach to this, and really take as much as we can from the alcohol side in terms of language that we're using in our legislation, in terms of processes we know work and that the OLCC knows works. And that's going to be our approach to the event and social consumption legislation. We're very concerned about some of the environmental impacts that current regulation have, particularly as it relates to childproof packaging, and particularly as it relates to the amount of plastic that we're putting in the environment. So we do have a piece of legislation that we've been working on, again, very pragmatically, and we've shared this with Steve Marks, that we are interested to see how we can incentivize the use of environmentally friendly materials, and at the same time have a thoughtful and meaningful conversation about childproof packaging. So I'm happy to share more about that, exactly what our approach is going to be. But again, it will hopefully be acceptable, pragmatic, and make Oregon a thought leader on this issue. We'll be a little bit behind where Canada is in terms of our approach because they've done something similar, but we're excited to see that move forward.
Amy, can I stop you one quick question? As a matter of procedure, and I don't know the answer to this, is that if you have a legislative priority, do you come to Steve or Rosie or somebody and talk to them about that before you go any further? Or yeah, I assume you did, but
Yes, so I had a call with Director Marks. I am in frequent contact, and it's one of the things that's so fantastic about the OLCC is the open communication that we have. So I had a meeting with Director Marks last week. I previewed all of these concepts and we spoke through them. And it's really important. I mean, the goal is to move the legislation forward, and in the places where that has to be implemented by the OLCC through rulemaking or other processes, we need cooperation. And in a lot of cases, we're hoping for sign off so we can work together on those. So these concepts have all been previewed to Director Marks and others. And I've also had a chance to work with Rosie on a number of issues. So the answer to that is yes, always.
yeah, I figured that you were smart enough to do that before you went any further.
Yes, so we have, and those are ongoing conversations throughout session. I anticipate, based on the number of bills that are already being introduced kind of across the spectrum at this session, not just in cannabis, that this session will be wild. And the more aligned both the associations are and the agency is aligned with the industry, the quicker and easier it will be for us to get good legislation moved and to stop bad legislation. And
Especially in light of the fact that all the new members of the legislature this year.
yes, Chair, it's going to be wild, I suspect, and especially I think also with redoing the building, it's everything from what's happening in the physical space to all of the new members and so many issues being presented. So I expect some pandemonium. So one of the other issues that we care about is expanding expungement. We think there's going to be a lot of criminal justice issues coming up this session. We also know that there's some members who have returned who are particularly fervent about criminal justice issues. So we're hoping that we're again taking an approach that makes sense and does not go too far, but we are working on expanding expungement, particularly as it relates to cannabis offenses, but not cannabis offenses that are commercial drug offenses or substantial quantity. And then we have a catch-all, which is market and license stability. So we were able to move the moratorium last time, and I think there's a question of what happens next. And that is a place where I expect there to be a lot of collaboration between the association and a lot of collaboration with the OLCC. So, we're going to see legislation in a lot of different bills. It will be kind of chasing those bills around, but I do think there needs to be a stakeholder conversation about the market and license stability issue. And I'm looking forward to having that. I know we've all got something in the works, but that seems to be something that is very important for us to get aligned on. So those are our primary legislative priorities. And we're looking forward to seeing some of those move. In particular, the consumption piece is long past due. And we're hoping to get a lot of support from the OLCC on that. The devil will be in the details, as they say, but I feel confident that we have enough smart people working on it to do something fantastic. We're also working on some regulatory priorities. This is work we'll be doing directly with the OLCC. Our members my members, the OCA's members, have a lot of concerns around testing and THC as the kind of benchmark for how consumers are purchasing cannabis. And I think in Mr. Taylor's testimony, you heard some of the new research that's happening, and there is a lot of concern about, I think, the accuracy of labs, the chasing up of numbers, and that the consumer has gotten so acclimated to THC being the only thing they're looking for and caring about, that we're really losing sight of what's actually important, both to the market and for consumers in cannabis. So I think that's something that's very important. We have a subgroup that's been working on some language, and we're looking forward to working with OLCC on that. And the OCA has been very strong on collaborating with the agency on enforcement issues. And we feel that that is an ongoing conversation that needs to happen, and an evolving conversation, especially as we're seeing the end to open licensing. So we're looking forward to continuing those conversations. We have a number of new priorities. And I, again, want to thank the OLCC. They've been very open to having that conversation with me. They were very open to having the conversation with our board members who led that conversation. And so again, it needs to be collaborative. It needs to take into consideration the enforcement challenges, the increased criminal activity that we saw. But it is important that we are able to support cannabis businesses during this very difficult time. And one of those ways is being extremely thoughtful about the enforcement piece. I also want to end with to talk about that we are here to support in the equity licensing conversation. We know there's the licenses component. We know there's a funding piece. And we're really have made ourselves quite available to be part of those conversations. And we are viewing that, given the current state of case law around that area, that the expertise we can bring to that is how to, one, make sure that anything we do is constitutional and will stand up to any sort of litigation. That's really important. We should have the very best program that there is that will also not wind up, looking at some sort of long-term litigation like so many other states. And two, that we can provide as much support on making sure that that programming really results in success for the participants. So we're engaged in that conversation. We want to be a good partner. We have a few unique skill sets that we bring to that conversation, and we're looking forward to those ongoing conversations. I understand that they will be happening. And finally, I want to say thank you again to the OLCC for being such a good partner in these tough times. There are a lot of challenges ahead as we hopefully are marching towards federal legalization. The OCA wants to be a good partner, and we're looking forward to 2023. I'm happy to answer any questions.
Well, as usual, you did a beautiful job. Thank you. Any questions?
Just one of the things that of all the different, this is Commissioner Revolt, there are many things on your agenda and on our organization's agenda, and I appreciate and look forward to two specific areas. One is market stability, what that means and what that means from a legislative point of view, and what our team is working on. And also, as I've gone to other states and looking at consumption, public consumption, this is something that I've been interested in seeing how we progress in that and kind of stand still for a while. So whatever is happening in that arena is that I'm committed to doing whatever we can, or whatever I can, is to be of assistance in those two areas. I think it's important that we take the leadership role again that we've always had, particularly in that area, and that will also help the stability. So thank you for talking about those along with the other areas you're looking at. And I think that when I talk with Steve, or I talk to Rosie or our team, that's something that I have high interest in participating with.
Thank you, Commissioner. That's really great to hear. And I have heard, I think, from other commissioners and from Director Marks that is this area of interest. And I think it is so important. And so again, I think the more collaborative the associations are and the agency is on this issue. I mean, there's obviously going to be on the consumption side, other folks, we have to modify the Indoor Clean Air Act potentially. There's, and then you get other organizations that care about that. So there will be a lot of moving pieces. And, this industry kind of ate itself, to be quite frank, around this issue before. And that's why I think it did not move. And I'm extremely optimistic that we will not repeat that mistake in 2023.
Any other comment? I'd like to mention one thing. This commission has a great deal of business sophistication on it. Really, I mean, if you look at any other commission in the state, I'm willing to say that our level of sophistication when it comes to business and business people is second to none. And the reason why, in my opinion anyway, that this commission functions as well as it does is that we have complete and total faith in our executive director. If we didn't, there'd be a big problem. And we trust the executive director and staff because they're very, very sophisticated. And the reason I say that is that it makes it very, very easy for us to work with everybody because we have complete confidence in our staff. That's invaluable. My biggest concern with everything that you mentioned, and I agree with you, is the testing area. It really is critical for us to get our handles on that. And, I've been frustrated over the last couple of years. I think we all have. Anything we can do to deal with that issue is very important to us. Thanks, Amy.
Thanks, Chair. And I do want to let the commission know, and I'm happy to answer more questions or to mute my microphone. But as far as the testing, we have been meeting regularly with a testing subgroup, again, across the verticals, because I think the producer's perspective and the processor perspective and the retail perspective are all different. And so our expectation is to come with a working document to OLCC to talk through that. And that document's in the process right now. And our expectation is in January to be able to bring something meaningful to the agency for consideration and discussion.
Great. That's wonderful. Thank you.
Thank you for the opportunity.
Go take care of your father.
Thanks, Henry.
Okay, we're going into settlements. No?
Yes,
No.
Thank you.
Sorry,
CIA. Yes,
not yet.
almost. So, good morning to Rosenbaum commissioners. It's an honor to be here today. Thank you for having us. I'm Jesse Bonnecue, the Executive Director of the Cannabis Industry Alliance of Oregon. The alliance was formed this year from the Oregon Retailers of Cannabis Association, Farms Inc., and Oregon Industry Progress Association. To best represent our 500 plus cannabis business members and ancillary businesses. We represent every type, every size, and from businesses and from every corner of the state. I want to apologize real quickly before we go further. I was not planning on being so tied to my notes today, but I have a 9-month-old that has decided that I no longer need sleep. So I'm going to stick to notes a little. I know it's more strictly than I otherwise would.
Would you raise your hand if you don't understand that?
We are, the CIA of Oregon is a broad-based, grassroots, member-driven organization. All of our policy positions are driven by cannabis licensees. Our mission is to create a thriving and respected homegrown cannabis industry that honors best practices and holds public health and public safety in mind. You all know the state of play right now is dire. The Oregon market has seen a massive downturn. At the same time, the revenue that is coming in has been spread amongst more licensees. And I've heard from many of our folks directly that November is the worst month they can ever remember for the industry. And so we, if Oregon is going to take its rightful place as the premier cannabis state in the nation, we need your continued support in Salem, i.e., Oregon should be the breadbasket of America once interstate commerce happens. And we need the support of this agency to help ensure our homegrown cannabis businesses are financially thriving and in a state to be able to take advantage of the promise and opportunities that national legalization will bring when it comes. I'll take this moment to pause and say thank you to the Commission and the OLCC staff for executing professionally and quickly on the most recent application moratorium. It has already been of a positive impact. More significantly, I want to thank the staff, the OLCC staff, for working to address the single plant metric tags and to work towards allowing batch tagging of mature plants. This is a critical change our team has been working on for years, and we are heavily invested in continuing to see this process all the way through. I also want to thank the Commission for the work that was done this year on enforcement reform, and look forward to continuing that, but it has been significant, and I appreciate the OLCC with working with the industry on that. The CIA has, just so as an orientation for how we look at our policy development, the CIA has threaded a few guiding principles and foundational values into our work. In ongoing partnership with all of you and the elected officials. So these are sort of our guiding principles. We want to foster and expand the consumer base and create policies that will stabilize the existing state confined market. We need to reduce and or reform the regulatory structure so as to be responsive to the dynamic business needs, increase efficiencies, and reduce unnecessary costs where they don't, without compromising quality or safety. And we want to enable more innovation and create a landscape that provides simplicity and clarity for licensees, which will also strengthen the trust between you and our members. And in general, as I sort of mentioned, all of this is with a vision towards ensuring this industry is thriving today, thriving tomorrow, and able to fully take advantage of the promise of interstate commerce. We have several pre-session bills filed for 2023, each introduced by longtime cannabis champions in Salem. These proposals represent a high watermark since the Joint Committee nearly a decade ago. Our bills have bipartisan and bicameral sponsors, and this is indicative of the progress towards normalization of cannabis as a legal commodity and the style and relationships that we are forging with decision makers. So we have crafted a three-pronged approach to our agenda. Through these omnibus proposals. We look to address a series of nuts and bolts fixes, inefficiencies, a suite of policies to encourage market growth, and policies that will seek to redress historic injustices that were caused by prohibition. So to the bills. I want to start off with a little note. The legislative process is obviously fluid. We work methodically with our members to develop our policy agendas. Therefore, it is absolutely likely, this is not a finished product, I should say, right? It is likely they'll have more good ideas and necessary fixes introduced in the future. Today, I'll primarily focus on our two pre-session filled bills, and I'll also briefly preview some unfinished concepts that we're working on, but just, as a keep it brief and broad. And as it is important to us that we approach the work carefully and methodically. So our first bill, we are deeming the technical fix omnibus bill. This bill is about modernizing regulations that aim to incubate better businesses through efficiencies and encourage innovation. It currently contains three primary concepts. One is allowing motion detection video recording. Two, allowing under 21 children and spouses of cannabis licensees and employees on the premise. Three, allowing the use of digital ID technology in place of a physical ID check to verify age for the purpose of sales. Now, I'll go through each one of these in a little bit more detail. Allowing the use of motion detection video recording in the place of continuous recording is something I have been working on for many years. The benefit of this to licensees is it simply reduces the amount of video storage that's currently required under the rules, and that would reduce costs, reduce risk. I know people have 23 terabytes of data for a single licensee stored offsite that they're paying for every month. So this is a big thing. Additionally, reduce the immense number of hours that would have to be reviewed by the agency in the case of an audit. What is the good of how many staff do you have who have time to review 23 hours or 23 terabytes of video recordings, right? So the OLCC would have the ability through rules to set the standards for the sensitivity of the motion detection cameras. And there would be an audit log that would be required to reveal if any changes were made to the system, including its sensitivity or if it was turned off. So in other words, this is a change that would save licensees money, the agency time, and maintain the current security levels. Second piece, allowing the accompanied, under 21 children and spouse of licensees, their employees, is exactly what it sounds like. Is about basic fairness, equity, and the normalization of this industry. The complete ban of children on licensed premises is unnecessary. It's very challenging for primary caretakers, which are disproportionately, just because of history, women, and is especially challenging for small business owners and licensees who live on their properties, i.e. farms, who happen to live, have a licensed property on the same tax lot as their home, if they have children. This change will make it easier for cannabis licensees to spend more time with their children, tear down artificial barriers and make it harder for women and small businesses to be successful. I think it should be noted that currently there's no equivalent level of restriction on the alcohol side in manufacturing facilities and in any facility where there isn't consumption happening. There is no consumption currently happening at any of our facilities. So basically we're looking for parity. Licensees with all the, and I think it also be noted that if you're growing 4 plants at home, there's none of these restrictions either. So we're really just talking about normalization here a little bit. And legal licensees, with all of the safety and security requirements that we are subject to, shouldn't be any subject to stricter regulations than home growers. Finally, in this bill, allowing the use of digital ID technology. I had no idea you're going to have the conversation you're going to have earlier today about the challenges with delivery. But I think this is apropos to that conversation. So in place of this bill would allow the OLCC to approve the use of new technologies for the purpose of age verification in place of the physical ID check. There are new technologies that can be used for age verification, which we are barred or heavily disincentivized from using because of the requirement to view a physical ID. The new technologies that are out there can do things like scan for every government issued ID, its security features, identify fraud, and match them against every government ID template in the country. Moreover, these technologies can provide an audit trail to verify compliance with age verification requirements. And these technologies can also be used to verify a customer before delivery, reducing the risk of robbery. In short, these technologies promise an increase in efficiency, an increase in compliance, and a reduction of risk for businesses. While this change is currently only applicable to cannabis, we believe it is equally valuable to the alcohol industry. And actually, when we initially submitted the bill, we requested it for both. However, LC told us we had to be limited to cannabis because of the relating to clause. But per your conversation this morning, I think that as you discuss what solutions are necessary to help improve age verification compliance with deliveries, looking at this language and this technology as a potential or part solution for your problems is 100% the right thing to do. Some additional ideas that we're kicking around in the same sort of bucket include to fix finalizing the application moratorium situation. So we have a permanent solution in place for when and in what circumstances the OLCC will accept new applications. And it's important that we ensure that interstate commerce is included for when that happens, that the agency has the ability to adjust to that changing dynamic on the fly quickly and efficiently. We also want to do things like look at smaller but meaningful changes, like allowing edible producers or processors, I should say, to make non-cannabinoid products on the same premise that they make infused products at. Currently, that's not allowed. So you can make delicious chocolates, but they must have a cannabinoid in them, not even THC, just a cannabinoid in them for them to leave your facility. But I think if you make great chocolates, should be able to use your facility just to make basic chocolates without infused priorities, without any cannabinoids in them. So that's our first technical fix bill. Our other primary bill is what we are calling our market growth proposal. As you can tell by the name, it's dedicated to concepts that foster new consumers and embrace a proven Oregon craft product market. It has three principal concepts as well. Allow for cannabis producers. So the first one is a change that would allow for cannabis producers to provide tours, limited tastings, and for sales to be made by retail license on site. The second is to allow for delivery to hotels and inns. The third is to allow for wholesale transactions and samples to be distributed at industry trade shows. The first concept is best thought of as the winery model for cannabis. It is one of the most significant changes we're asking for and one of the most necessary due to market conditions. It would allow cannabis farms to educate customers about the brand, their methods, and the unique aspects of cannabis. Farms would be able to provide limited samples, less than a gram in total, to customers for on-site tastings. And finally, the farm would be allowed to partner with a retail license for sales to be made on the premise of the farm. This would all be subject to local control, and any tastings would have to comply with the Clean Indoor Air Act. We see this as a linchpin in encouraging more cannabis tourism and market growth. The second concept, allowing for delivery to hotels and inns, again, very simple concept. It's exactly what it sounds like. We're not saying that hotels and inns have to allow delivery or consumption. What we are saying is that the state should not have a blanket ban in place. We're simply saying, let the market decide. This is also about making it easier for Oregon to become a hotspot for cannabis tourism and expanding the market. Finally, we want to allow for wholesale transactions at cannabis trade shows that are registered with the OLCC. Essentially, we want to allow transfers to be made and samples to be distributed at registered events just like they would be the normal course of business on a licensed premise. The large number of restrictions on how and what ways cannabis may be present at registered cannabis events make them very difficult to manage, severely reduce their potential value, and severely reduce the potential value they could provide to the industry, especially for rural processors and producers. It is important to note that these efforts specifically focus on business to business events and not consumer facing events. Our goal for this fix is to, if your vision of like, what would this look like, right? Would be, for example, rural farms and processors come to a Portland event with a substantial amount of the product, be able to distribute samples to other licensees and permit holders, and make transfers to them all in one trip. Currently, they would have to return to their farm and then make the transfer, necessitating 2 trips, and they could not distribute samples. Please note, we're not at this time advocating for allowing tasting at said events, although that would be amazing. It has also become clear in the same, again, bucket that we need to provide clarity for retailers on how and in what ways they can have discounts and loyalty programs. We want to work on sampling, reform, transfers, and special events, which I would say is essentially in line with what Amy was talking about for temporary events where where tasting can be allowed, where sales can be made. And so I think that is a place where you'll see a lot of unity.
Let's say, let me just interject right there, right? I think your provision and what Amy did in discussion, they both have a local approved ones there. It's just not a statewide deal, or is that still subject to discussion?
No, so I can't speak to exactly what Amy his goal is yet.
Yeah.
We'll be meeting in the near future to get into more detail. I can say we are very sensitive to local control issues and want as little opposition as possible. And so have been and will continue to work with the counties and cities to make sure they're happy. So there's also a large amount of low-hanging fruit in terms of regulating cannabis as a state. Low-hanging fruit that we want to make progress on in terms of how the state engages with our industry and making sure that we are not treated any different than any other industry. This includes elevating the fact that some of your sister agencies in the state do not feel they have the ability to interface, work with, or support cannabis businesses safely. We want to change that. We thank you at the OLCC and urge you to talk with your counterparts.
So you want us to negotiate with other organizations on your
No,
behalf?
we do not want you, no. We just want you to encourage them not to be scared.
So that's not negotiating, but encouraging.
Yeah, yes.
Semantics.
Yes, no, we thank you at the OLCC, encourage you to talk to your counterparts for not falling victim to this kind of discriminatory, non-statutory decision-making. Thirdly, we remain deeply committed to addressing the injustices and destruction of intergenerational wealth caused by the field war on drugs. And as such, are taking an active role in crafting and passing legislation that will expunge the damaging criminal records for those who have them, and supporting direct financial investment into communities that were disproportionately affected by the war on drugs, including investing in entrepreneurship. Finally, amongst the proposals that we're prepared to respond to, there are a large number of proposals we're prepared to respond to, i.e. defeat and defend against. The primary one that is on our horizon that we are prepared for is a threat of increasing the cannabis sales tax. We oppose that vehemently and will do everything we possibly can to fight that off. Other bills we have pre-session filed include ensuring eligibility for licensees for all economic development programs offered by the state. Basically, want to ensure that the cannabis business would be able to qualify or at least apply for any benefit that any other business would get in the same, in a similar vein. And just to ensuring eligibility for programs, continued improvements to our CTS system and removing and again, aligned with, or not necessarily aligned with, but in the same vein that Amy mentioned, removing and improving our ability, removing plastics and improving our ability to recycle plastics that overrun our environment, impact our climate. And then finally, we are looking forward to continuing to help shape any policy that is enacted that relates to us We appreciate the leadership of Senator Prozansky and Rep. Marsh Morgan and how they will have an open door policy as we press for safe and reasonable market regulations on artificially derived cannabinoids and specifically CBN to make sure that Oregon does not fall behind the national marketplace in this relating to these products. Currently, the most popular edible in the world, if not in the country and world, is a CBN edible. So we need to make sure that Oregon is not left behind with that marketplace. Overall, it is with optimism and strength and advocacy that the CI enters the 2023 legislative session. In the past few years, your agency and industry have leaned in, have learned to trust each other and our partners for better outcome. We really appreciate that, and we look forward to continue this work. I also want to say, broadly speaking, at the 10,000 foot level, there's nothing that I heard from Amy that I don't think the industry and us, support and want to find as much alignment as possible on and create a unified force behind to support. So with that, again, just thank you. I'm here to answer any questions. I know I went off on a lot in some detail, but I wanted to let you know exactly where we are, what we're working on, and make sure you have the opportunity to ask me questions.
Good job. You mentioned, you did go into a lot of stuff, and I'm glad that CIA and then the host, or what do we call it?
CIA of Oregon.
Okay. The CIA of Oregon. But no, I'm glad that everybody's kind of getting on the same page and working together on the stuff that's important. And I also think, when I mentioned it last meeting, when we passed the rules package, what's been good is I think with you guys and the leadership of the associations realizing the role that the agency plays, and sometimes they're at odds, but generally the agency here, we all want to advance stuff as well. I won't speak for everybody else, but I know that the agency, within the confines of their responsibility, wants to see stuff advance, and I would think everybody would agree that, like Director Marks, Rosie, the whole team has been accessible, and I think when there is differences of opinion on stuff, it's not necessarily that the agency is trying to be a downer. It's just that they're sometimes there's different conversations going on at different levels. So I really appreciated the open lines of communication. We'll continue that, and the maturing of everything. And your guys' role is to normalize and get things advance the industry. And I think that's important, and it's important to be on the same page. And the one thing too, and Marvin touched on it, but there's a lot of other agencies and groups that are not OLCC. And so in a sense, OLCC kind of has to stay, keep its eyes on what it has to do, but can definitely provide, insight on it. But I think, on the consumption stuff, a lot of that is going to be at the county and state level. And it's important to be engaged in those conversations separate from with OLCC, because I think, I don't know that that's probably a role that OLCC can, I'm just telling you, like it or not, or maybe individual commissioners can help you out, but I just don't know that the agency as a whole can take up those.
Yes, and we are definitely sensitive to the voice of the counties and localities. And it is like we've engaged with them whenever we've done this project before, and we're going to continue that. And we know that this is not the only agency that has influence over or government body that has influence over or an interest in how we are regulated or enforced. And it is my responsibility and our lobbyists' responsibility to ensure that all of those voices, that we engage all of those voices and make sure that there's as few roadblocks as possible in front of us when we're fighting for this legislation. But thank you.
You're doing good. Well,
and seriously, there's been a lot of progress on, I think, just as a general statement, I've seen it and felt it. And it seems like there are good trends in place for a continuing work with the agency, and staff has been very accessible to me when I have questions about this, and getting feedback and help. And I look forward to continuing that aggressively, because this is just our legislative piece. Got a whole big thing for rulemaking that is a separate conversation, but we also have a long list of priorities we're working on there as well. Is there another question?
yes, there is.
Hi there.
Yeah.
So two issues, on your legislative agenda that I kind of heard and frankly, I'm really happy that the organizations are finally putting together. That's something we talked about years ago. Pull together, create organizations and having the ability to have legislative pull. I hope you're prepared to have that. You're ready to fight and increase sales tax with the mayors and cities throughout Oregon because they're not happy with how we allow them to tax or not tax. We've had conversations with some city council people over the years about, no, you can't have a 40% tax rate, sales tax rates, 35%. So you made that statement to us. Are you also going to make that statement to the mayors and the cities because you're very locally sensitive?
Yes, at 100%. And I don't think that any of them would be surprised at this moment about the statements I've made in relation to sales taxes.
The next part of that is that, as you know, we all talk about how we're looking forward to interstate commerce. And I would ask that you work with your members to find out how the federal government taxes alcohol and where they tax alcohol and how we are at risk as a state of losing billions of dollars of revenue if where we tax marijuana is not altered. So I don't know if you're aware of that.
I've been actually engaged with our congressional offices and specifically Wyden and Merkley's offices around this issue and advocated quite significantly and heavily for a different tax structure than what's been currently proposed in the CAOA, the Cannabis Authorization Opportunity Act.
And who you're talking to someone in the state of Oregon.
I've been talking to Senator Merkley and Senator Wyden.
So what I'm asking is the state of Oregon, because we tax at retail, right?
Yeah.
And not growth.
Yeah.
And I'm RJR Reynolds.
Yeah.
And I want to buy 40 million acres of product. And I don't want to buy it at retail.
Yep.
Are you gonna lose money? Or are we gonna lose money?
I would anticipate that the state will have to adjust its tax model along that process. But I also think that the federal government should be engaged with the state and state regulators to figure out the best way to do that and not do a hands down, top down thing and just copy the model of alcohol because it doesn't apply perfectly. And I've talked to Commissioner Marks, or sorry, Executive Director Steve Marks several times about this. I intend to reach out to the CANRA to try and do that. I coordinate a national call amongst trade associations across the states where we've talked about the tax structure and how we can do this. And one of the concerns that has come up is the conversation over will the states lose tax revenue directly to the federal government? And is that the right, and I think it's an open question. I have my personal opinion, but is that the right way to do it? Or should we be working to keep more of that money in states for them to spend it more directly on the projects that the states deem necessary? And so I would just say, maybe I don't know necessarily all of the pieces, but this is a conversation I have been engaged with for over 2 years now. And it is an important one to be had.
Thank you.
Any other questions? I couldn't resist one thing. You said in your opinion, and there was many agencies that affect your business. You don't have to answer this question. I was gonna ask whether we were the most important agency that affects your business. But I didn't, you don't have to answer that question.
I'm happy to say you guys are definitely the most important
So
agency. But, we are affected by Business Oregon.
No, I understand. The question I wanted to ask you is, put blinders on, complete blinders. You got one choice, one issue, legislatively. Which one is it?
I think it's hard to say, honestly, because the industry is moving incredibly fast. And I think it behooves our state to move as equally as fast as the industry to ensure Oregon stays the premier state in the country in relation to cannabis. That being said, if you've twisted my hand and you break my arm about it, I would have to say that market growth is absolutely essential right now. Creating more revenue streams for the industry, enabling them to innovate and bring in new customers is the most important thing we can do, is grow the industry.
That's not coming without federal intervention.
Well, internally though, that's why we're looking at how can we improve and look at things like the new revenue stream. So where we can benefit from consumption, like tasting on farms, new types of events, delivery to hotels, where it'll be easier for this state and this industry to develop a cannabis tourism and work with customers. So I think it's really, that's a key important part, is enabling the industry to develop and find new ways to generate revenue.
Well, strictly talking from a business point of view, all that's immaterial compared to federalization issues.
Oh, federal legalization solves a lot of problems.
People are holding on by their fingernails, waiting for it to come.
I 100% agree. I mean, it's the promise, right? That is this thing, and it keeps getting moved and moved and moved and moved.
It'll come.
But it is inevitable. I mean, this last session, we added 2 more states to, that for adult use in this last election cycle. The vast majority of states, I think it's now 37 or 38, now have some form of medical and/or adult use. It's just the direction that's coming, and it's incredibly frustrating that the federal government is moving as slow as they are. That being said, it is inevitable. So one of our focuses on is not getting to the finish line, so to speak, totally burnt out, broke, and barely surviving. We want to welcome that day of interstate commerce with the cannabis businesses in Oregon as financially flush as possible and as financially strong as possible to fully take advantage of that opportunity, because it will cost money for people to expand production, to expand manufacturing, to do new marketing. And if they don't have that in reserves, or they are financially weak and have a ton of debt, that is going to make it incredibly hard for them to do it without selling out this industry to moneyed interest from other states. Oregon is going to be a cannabis breadbasket, whether it's homegrown or not. So to me, the question is the money staying, is the excess profit and revenue staying in state, or is it being siphoned back to New York and California and Illinois?
Jesse, well said.
That's the vision, right? So that's the warning. Our hope is to work to ensure that we're in a place where that will happen to some degree. Of course, not saying it's bad, but I don't want it to have to happen. That's the only way. I want people to be able to go into that space from a position of strength, not a position of weakness.
Thank you very much. Appreciate it.
Well said, Jesse.
Well said. Okay, we're on to the settlement issues. Michael, good morning. Well, it's good afternoon now.
Good afternoon, Chair Rosenbaum, members of the commission. For the record, I'm Michael Shine, lead worker of the Administrative Hearings Division. And we have 2 alcohol stipulated settlements that we propose for ratification by the commission.
I think I could save you some time. Is there any questions on any of them? No. Save you a lot of time on it. I need a motion.
Chair?
Commissioner?
We're just in alcohol, correct?
Yes.
Okay. I move to ratify the 2 stipulated settlement agreements as proposed by staff.
Take the roll, please.
Commissioner Curran,
Yes.
Commissioner Doherty,
Yes.
Commissioner Floyd,
Yes.
Commissioner Japon Porter,
Yes.
Commissioner Miletus,
Yes.
Commissioner Revolve,
Yes.
Chair Rosenbaum.
Yes.
Thank you,
Michael?
commissioners. And we have one marijuana stipulated settlement agreement in Falcon Wholesale proposed for ratification. Be happy to answer any questions you may have.
Are there any questions?
I got a quick question, Chair.
Please.
Michael, good afternoon. These guys self-reported, correct?
Commissioner Floyd, they called an inspector requesting destruction of marijuana that had failed pesticide testing. However, they did not self-report that it had been transferred. That was discovered by our inspector when looking into the request for destruction.
Okay. So do these guys, do they go through the verification of compliance program, or do they not meet the requirements for that?
They did not. This is actually a Category 1 violation. We did mitigate it downward in terms of the proposed penalty, and but it wasn't eligible for verification of compliance.
Okay, thank you.
You're welcome.
No further discussion, please take the roll.
Do you want to make this?
Oh, I need a motion. Sorry, I thought we had that already.
Sure, I move to ratify the stipulated settlement agreement for Falcon Wholesale as proposed by staff.
Thank you, Commissioner.
Commissioner Curran,
Yes.
Commissioner Doherty,
Yes.
Commissioner Floyd,
Yes.
Commissioner Japon Porter,
Yeah.
Commissioner Miletus,
Yes.
Commissioner Revolt,
Yes.
Chair Rosenbaum.
Yes, thank you. That was
Thank you.
Okay, next I recognize Executive Director Steve Marks.
We have a little follow-up on an announcement I know you're aware of. Jason Hansen will be leading the agency for a fantastic opportunity with Department of Corrections. Lead, what's the, not Rock Creek,
Yep.
no.
Columbia River.
Columbia River.
You have a mental block against
Yeah,
that.
yeah. Rock Creek is the one where I have a room reserved for me. I think when I will next session. So, really appreciate all of his service here. And, Rich, would you come up, please?
Good morning, Commissioners. Good
morning.
Rich Evans. Jason, hold up. So most of you know, obviously, that Jason's leaving now, but I want to take a minute to talk about what Jason did while he was here. Jason was here for about 5 years. We hired Jason back in April of 2018 when we started the statewide medical marijuana program from ground zero. And Jason came in and actually started that program, worked with our partners, and basically completed a whole compliance program that still exists today. Obviously, we noticed how well he did and the work he was doing, and I know that each one of you have worked with him. And then when Danica left licensing, we were in turmoil, as you know, because of COVID and the industry. And so the executive team moved Jason into that position. And during that time, you know, of all the COVID restrictions that we had to get through, you know, of all the changes like roadside seating and drive-up windows and all the work that we had to do, Jason was instrumental on that. And then when Shannon left, we were able to move Jason over to our compliance group, which obviously has been working a lot with the industry on reforming how we do our business. Jason has been instrumental in that, plus the VOC program, plus basically trying to simplify everything we're doing, and then all the work that we're trying to do with our new IT system. And then taking what we do in compliance and when he was in licensing and trying to streamline that work so that it does fit within the box with IT. Jason and I have talked a lot about his career goals. And I knew that he wanted to be a superintendent of one of the state prisons the whole time. And Jason and I have kept in touch, and I've never, ever felt like when an employee is leaving to better themselves and better the state of Oregon, and we should celebrate that.
Amen.
And Jason's obviously worked hard here. He was recognized for his work, and I think a lot about the man. His moral compass is always north, and he's always doing the right thing, and I never have to worry about that. And working with a guy like that makes us all better. I'm very proud that Jason was here. I'm proud to work with him. He knows that. We talk all the time, but I know that he's gonna do good things at the Department of Corrections, and maybe hopefully someday he decides that he doesn't want to do that and comes back to OLCC doing something else. But I just wanted to take the time. We have a bunch of, you guys know this, but the employees that we have that work here are very dedicated. You heard it from the industry today. I wish we could spend more time talking about all of our employees because they do such great work. But Jason was instrumental in a lot of programs in a short period of time. And the one thing I will tell you at OLCC, I've been in state government 37 years, this change is inevitable here and it happens almost daily. And you really have to be on your game to keep moving things forward with all the pressures that we have. And Jason's a champion of that. So I wanted to present him with the challenge coin today from the executive team. We hand those out, as you know, very rarely, and this is the third one I've ever given out. And I appreciate Jason being here. I don't know if Jason has anything to say, but the commissioners, I know when we go on road shows, you see Jason interacting, you see him interacting with the commission all the time. He's done in this 5 years, yeoman's work here. And I wanted to recognize him today. So Jason.
So I am humbled. Every day I come to work, I'm humbled. There's not anything that my name was attached to that if there was any success, it's because of the people that I was honored to work with from the day one to today at this agency. I've shared with many folks, and I will continue to share that this agency, I feel like, has an extremely high ratio of all-stars. Small agency, but truly powerful in what they can do. People that want to work every day, care about the industries that we regulate, and want to see success, not only for the state, but for themselves, the industries. And I've learned in these almost 5 years, I've grown more than any other span of time in my career. I know that the opportunities that have been made available to me will help me in everything I do in the future. I'm thankful for them. I thank Rich and Steve and everybody that I've been able to work alongside. It's been an honor. It's been easy. See, as hard as the things that we've had to deal with, especially the last few years, coming to work was easy. I knew that I was surrounded by people, someone that had the answer every time. And so all I had to do was just listen. And boy, that sure made my job really easy. So any success that I have is really on the backs of so many other individuals. And I'm thankful for them. I hope they all know that. I look forward to the work that continues to happen here. So thank you all. And thanks to the agency staff.
Well, Jason, on behalf of the commissioners, and I'm sure they'll want to say a couple of words themselves. Well, I told you in private that I know quality in people, and you have it. I was immensely proud of you, and I told you I didn't tell you that often enough, but I think the words that were echoed about the fact that you're going on to a position of responsibility and promotion, and anybody that really understands that just not only agrees with it, but promotes it. We're proud of you. You've done a beautiful job. I'm personally sorry to see you go, but I have no problems in seeing you go because you're going to better yourself, and that's what life is all about anyway. So just God bless you and do well and stay safe. Commissioners, anybody?
I've shared what I wanted to share with Jason. You share.
Well, Jason and I talked a lot. I mean, and a couple things that just popped out of my mind is like, where we talked a lot was like, whenever there would be an issue come up, whenever there was a licensee or some issue, and I would always call Jason, and he said there would always be a solution. I knew if I called Jason that the issue would get dealt with, and it would get dealt with the right way. And and even if it wasn't an answer that the licensee or the person wanted to hear, he would handle it in a way that they left feeling like they were heard and listened to. So that was always good. I knew when it was a jam or something, I could always send him to Jason, and he was solid. Yeah, and we've had a lot of, especially during like the COVID period where things were just crazy. Like, and there was so many things that were changing, and so we had to be so quick on our feet and nimble and customer service oriented. And again, Jason working in his capacity at that time did a great job along with the rest of the team. yeah, no, it's like, clearly, whenever anybody goes on to improve themselves, it's gonna be good. And Jason's gonna be a person to watch. I mean, I think in this state, whether it's, superintendent, whatever it is, I think it's a rocket trajectory, because you come across people in, I mean, this is my first government position, but you come across a variety of people, and the people that can deliver and can really do a great job in state government are, you stick with them, and you stick with the people that stick by you. So, anything you need of me, anything I think you need from any of us, I think we all got your back, because you had our back when we needed it. So thank you for everything.
Yeah, thank you, Jason. I echo Commissioner Melides's sentiments. You've always been there anytime I've ever needed a question to anything. And even if you didn't know the answer, you sought out to your staff and whomever had that answer, and you got back to me with ninja fast responses. And sometimes even, outside of working hours, you went above and beyond, and I appreciate that. And I'm going to miss you. Selfishly, I'm going to miss you. So thank you.
Jason, thanks for all you do here. Being the newbie on here, you're one of the guys that shifted my view of what government was about, because I was on the outside and didn't have as the depth and power and that you bring. I didn't understand that until I got here, and you showed me what character is in government and caring is in government, about your employees, about us here, about everything you do. Your impact has been significant on me, and I know it's been significant on your team in a great way. So, and I hope that you and I maintain a relationship afterwards, because
you just don't go over to the prison, that's all.
I think they got a place for me over there. I might have been there one time. So God bless you. Thank you so much for your impact on me.
Well said.
Believe it or not, I got nothing to say. Other than thank you a lot.
One last comment. When you go over there, if you don't have a badge, ask Rich for it.
Never gonna end.
Thanks so much. And good luck.
Thank you so much, Jason. Yeah. Happy to work with. Yeah, I just want to say, I know what this role is he's taking on. It is a big role in the directions. You're going to supervise employees, populations of communities, literally communities, right, inside there. And I get a work camp, but tremendous amount of responsibility. I know you're up to it, and you're going to be great over there. So appreciate what you're going to do, Jason. Thanks for everything you did here. Thank you very much.
Bye, Jason.
Boba, you're up.
Yeah.
Afternoon.
Good afternoon.
Commissioners. Well, I'm back here. I promise we're gonna try to come once a quarter and give an update where all our large IT initiatives are. So I'm gonna do one today. I believe last time Christy Scott, my team was here with me. She's out sick today, but she asked me to say hi to everybody. Chairman, she said to say hi to Paul, so.
She does a great job.
Thank you. So I'm hoping to keep this presentation relatively short. In IT world, boring presentation is a good report, but hopefully it's not too boring. Next slide, please. So first project that I'm gonna give a report is our marijuana and liquor licensing and compliance system. So I mentioned last time, we had our vendors on board working with our staff, and what happened since last time I was here, we completed our 5th gap analysis session What those sessions were is various stakeholders across the OLCC sitting with the vendor and looking what the out-of-box functionality of their solution provides already and how, and then where the gaps are with how the OLCC does business, because every state and every customer is different in the way the businesses perform. So the out-of-the-box system's never going to hit 100% the way that we want it. So that's where the customizations come in place. So that the final report was delivered on November 24th. And we identified 96 fields that needed to be added to the system for phase one, which is the marijuana. And 14 business rules have also been identified to be added. That is pretty good, considering that that means that the system out of the box already gets a lot of what we need. And there's just a certain number of things we need to add to the system to make it work for what we need. So the next phase in this approach is the vendor goes back, takes the list of gaps that we had, and they do the wireframing of how they propose the system to address and what add-ins needs to be happening to address the needs that are not happening out of the box. External shareholder demos are scheduled for January 10th. So this is where we bring some of the industry to look at us. And again, this is still work in progress. We don't have a final solution, but so it's where we are right now, but we kind of want to expose them early on and kind of get some feedback in and see what they think and maybe see where we can make some changes along the way that would fit well with the design session that we are right now within our system. Marijuana licensing in general is scheduled to go live in October 2023. So that's when we're hoping, if everything goes to where
We're not holding our breath on that, are we?
No, actually, I think on that part, this is what's within our control. So usually what would sit within our control, we have pretty high confidence that it's going to happen. Now, again, we don't know what the proposed changes might look like and how much effort that's going to be for the vendor to adjust, and what feedback we get from the outside stakeholders, but I think January 10th is a pretty good date.
What was the criteria for the external stakeholders demo?
There's a lot of conversations that went into that. We have various groups within our agency engaged because we can't get everybody on board. There's way too many people, but there's a list of names, a list of the entities that were suggested from the business. I would have to go back to my team and see exactly who was involved, but I can tell you that it was pretty extensive.
So this is just preliminary.
Yeah,
Okay.
Yeah, it's preliminary. That is correct.
Yeah, I know how that goes.
Yeah. So phase two is a liquor licensing. So the way it goes, we kind of try to overlap this work, marijuana and liquor. We want to, we don't have enough bandwidth to do it both at the same time. And vendor doesn't want to do it that way either, because it would be too many things stepping on each other's toes. So, but we have to overlap part of it so we can kind of keep rolling. So the fit gap sessions for liquor are scheduled to start on February 28th. So as we are proceeding with the design to address the gaps with the marijuana, at the same time, we're going to be starting with the initial phase for liquor. And then we're going to move on from there on. So February 28th is we're planning to keep those sessions. Again, what we already did with marijuana, that's when we're going to start with the liquor. Next slide, please. So the Still Spirit supply chain, the SSC system. So this is the system that is kind of going on the heels of MLLC and requesting our RFP that we've been working on for a long time now. And we're still working with DAS Procurement Services, and it's nearly complete for review by Department of Justice and Enterprise Information Services, EIS, and Cybersecurity Services, CSS. So we got a DOJ feedback on 11/28. We have follow-up meetings with DOJ on 12/8 and 12/14, and we are anticipating final review meeting on December 22nd. So fingers crossed, if everything goes right and if everybody's in agreement and we got the final green light from DOJ, and all the other entities. We're hoping to have the RFP released on the street in next 2 weeks. So hopefully by the end of the year, we got the RFP, which is going to be a major accomplishment, because again, we've been working on this for quite some time now. So we'll let you know how that goes, but if everything goes right, by the end of the year, we're going to have the RFP out. Slide, please. Our professional services contract. So as I kind of showed last time, we have 3 major vendors that are, that's the vendors outside of our solution vendors. That's the vendors or partners that we're working with on all of these projects. So planning and integration consultant, RDI, they have completed and delivered unified data matrix for the Still Spirit supply chain. What this is, it's actually a very large effort that RDI worked with our staff, with my department and some of the other departments, subject matter experts were needed. What this is looking across the board of the SSC and finding where are all the various sources of data that we have, they're going to have to migrate to our new solution. And right now, as we know, remembering all the spaghetti monster reference that I had in the legislature. So that's where we're trying to document all of these different pieces and see where the different pieces of data lays, where it sits right now, and then document it, what type it is, where it is, and then go through the process of figuring out how we're going to migrate and what are we going to migrate.
What I don't understand is that provide testing support, MLLC and privilege tax. You're doing the testing on the privilege tax now, aren't you?
Yeah, we are.
So
But
what-
we also have the outsourced staff with the RDI. They're supplementing our staff. They're helping out because we have a lot of projects going on. So they're also having the testing specific.
Are
staff.
we hiring somebody else on the privilege tax again, or what?
That's the same company that's been working with us all along. So they were here from the beginning. This is just continuing support that they had already been providing with us.
Because we're going live on that fairly soon, aren't we?
We did, and we're actually actually, I'll go to that. That's going to be one of the slides. So maybe
Okay.
I can elaborate on that where we are.
All right.
Yeah, the privilege tax is going to be, we went, but just real short. Yeah, we went live, but it's in phases. So there are some phases that are still not live that we're rolling out as we go. But I'll be there in the next few slides. But Independent Quality Management Services, which is Gartner, they provide initial assessment for our MLSC project, and they're providing the RFP requirements review for our distilled spirit supply chain. So again, just continue to what we've been doing. I just give you a quick update what they done most recently for us. But again, this is ongoing. Organizational change management, that's something that has not been in the past. And so that is the new element, a new vendor. Barry Dunn has been selected our organizational change management vendor. So we also have a competitive process, and they were the successful bidder. Contract is currently in DOJ review, so we still have not engaged in the actual work. We need to go through the DOJ review. But what they're going to be doing is supplementing against the bandwidth of our OLCC staff across the board on the business side, internally and externally. And we're trying to kind of beef up the onboarding for staff and licensees permittees in order to avoid some of the issues, difficulties that we had when we rolled the privilege tax, and we are supplementing some of that. So we have more outreach with the actual industry and with the licensees, and kind of give them more support, how to get on a new system, onboard them on a new system. At the same time, also work internally with our business units, because they're going to be having lots of changes internally. So these guys are going to be there, and they're going to be providing their staff and developing some documentation and training materials and so forth to help us with the process, with the new systems they're going to be rolling out.
Chair,
Commissioner.
we all know the difficulty with personnel with DOJ. We're expecting significant delay in this progress, or any delay in this process.
That's always a difficult question, because I don't think any of us can really answer that question. What I can say is that we are very, very close. And part of the thing is we have the DOJ is working with us on many different things. So This is just one project that they're working. We have Ellen very hard, and they have to prioritize just with us, we're just one of the agencies that they're working on. But I can say is that we're getting really close. So I think we're gonna get this done relatively soon. And then we're gonna be able to engage the actual work very soon. So Commissioner Roll, as much as I can say is, I think it's looking good for this particular effort. Again, I don't think we can give any promises because I think nobody can. But it's looking good.
Okay, thank you.
I'll just add here, you know, there's a risk every time with this, right? And we
Right.
just gotta know that it's there, but Ellen at DOJ, who's our counsel, works on these. She has been working with us a very long time, knows our projects, knows our list of projects. And so, you know, there's other state priorities that she has to spend time on. But, you know, every time we get to the point, she's been able to figure out how to get enough time to get us through. That might not always be the case, right? And they're short on employees and staff like everywhere else. So it's procurement and state government. So, you know, this is not only just these IT projects, but even the larger project like construction of the warehouse and otherwise. This is a risk to timing of all the projects, and it's just there. So.
Just because I think we're more important than everybody else.
I just want to say, if the rest is to you, if Boba wasn't CIO of this organization, I'd be a big pain in the ass.
You would.
I would. I am.
No comment to that. That's
Yeah, you're not supposed to make a comment to that.
So this is the budget, and again, there's no really change in our budget from what we showed last time. The only thing that we had in pipeline, but it's not, we can't put it on this chart yet because we don't go through all the steps. There is an amendment, the Gartner contract amendment, which is our external quality assurance vendor. It's about $99,000. And that's just because more of our projects are now coming in their scope. So we have to amend the contract and have those $99,000. Everything else is still, the budget is the same what we showed last time, and we don't anticipate any changes that we know at this point in time. So not much to comment there other than we showed it last time. So we show the chart again. And this is broken down by the biennium and our funding sources and across our vendors that we're under contract.
You know, this is a classic example in the world we live in. Everything that's not completed and goes a year down becomes much, much more expensive. I mean, I don't think the general public understands that, but that's a fact of life today. I mean, the quicker we do something, the less the cost is gonna be.
And for example, to kind of illustrate what the chairman just said is that just happened with one of our other contracts is we had Deloitte, that was a successful bidder for our migration from our Microsoft 365 tenant to EIS, and their initial estimate was that we got a quote was about 9 months ago, maybe something like that, 6 months ago. And by the time we got to actually get to sign the contract, now the price has changed. So it's just
Yeah, it's happening everywhere.
Next slide, please. So this is the privilege tax update. Chairman, you were asking earlier where we are. So yeah, we have gone live already with some of the other phases, and they're already in production. And where we are now is the online filing for Oregon Wine Board, which has been released on the December 12th. And this is to allow licenses to file and pay for the Oregon Wine Board through the privilege tax system. The next release of system functionality is for annual wineries licenses, and that's the report January 2023, which will be followed by monthly wineries and grower sales privilege and bonded wine warehouses filings in February. So again, we have many different phases through the privilege tax. So I know it's kind of hard to keep track because there's many different things that we are rolling out, but this is what's coming next. So wineries, Oregon Wine Board, and annual winery licenses, and then monthlies are coming on board. And our staff is also working on the final phase, which contains the audit, reconciliation, reporting functionality. So that's supposed to be that is the last piece of the privilege tax rollout, and that it should be completed in summer 2023. So that's kind of some of the administrative functions and functionality was what was left for last for all the various reasons, strategic and tactical. So that's where we are with the per tax. Does that kind of give a better picture or explains where we are? Yeah. Okay. Next slide, please. This is, I know it's kind of hard to read it on the screen, but this is our schedule update for all the projects. This is the kind of the view where we try to overlay everything kind of happening at the same time. I don't, you guys probably get a better view on your individual monitors than what is here on the TV, but the main change since the last time we showed where we are was the vertical red line shows you where we are right now. And initially in the previous slide, we were hoping to have the Distilled Spirit supply chain RFP released already, but that did not happen. So that's the main change. You can see kind of where the star is there, where we're hoping to release, which is again, hopefully happens by the end of the year. If not, beginning of the January. But anything else is still, as far as we know, again, a lot of the blue area is the stuff with the Distilled Spirit supply chain. There's much more kind of range that's much more of a guess because it's further down in the future. But things like privilege tanks, the pink side and the green, which is MLSC, are much more accurate because we know it's already happened.
Throwing more bodies don't make a damn thing on this.
Next slide, please. That's next slide is the questions.
I think it speaks for itself. You got your hands full.
Cool.
Yeah, thank you.
Thank you, Boba. Excellent.
Are you gonna stick around for a couple of minutes? Or you leave it? If you can.
Okay, sure.
And Mr. Chairman, that just shows you how far we've come since Bova's been here. Look at all the projects and work.
And how far we have to go.
Margaret remembers our initial, I think when I came here in 2013, I mean, we built up an IT department out of rudimentary exploitation, COBOL tools.
COBOL.
Yeah.
And how far we have to go.
Yeah, a long way to go. Yeah.
Would you please introduce yourself, sir?
Good afternoon, Chairman. Good afternoon, Commissioners. My name, for the record, is Chris Maton, Distilled Spirits Program Director for the OLCC. I'm here today to give you a third quarter update on business for retail and distribution. And combined with that, you'll see a lot of duplicate charts. What I did was I gave you a third quarter view, and then I also gave you a trailing 12 view, which would be the trailing 12 months. So you could kind of see if there was any significant changes in that. And at the end of the presentation, I'll then give you a warehouse update. I don't have any slides for it, but first thing I'd like to talk about is really the marketplace trends. As if you go to the Q3, you'll see that the spirits industry in Oregon growth has continued, up 4.3% in the third quarter, which was about $8.8 million. This is the distilled spirit sales coming from retail stores. Volume, if you remember the last time I reported to you, was headed south. In the third quarter, volume again was down about 0.1%, which is equivalent to about 8,800 750 ml bottles. So it's not a typo up there. $8.8 million increase with 8,800 bottle decrease is the difference. Two main drivers continue to be on-premise sales, continue to grow, and I'll show you a slide on that in a few minutes. And then premiumization across all categories. Consumers are buying up. They're not buying more. They're just buying up. Next slide, please. This is the trailing 12 months. So you can see revenue increased by 38.1 million, up consistently about 4.8%. And then volume for the trailing 12 continues to be a decrease in volume, down 1.3%. And again, same two drivers for the 12 months. They've been consistent year long. Next slide, please. Licensee revenue, a lot of talk about that. I'm sorry, Commissioner Floyd couldn't be here to hear it, but licensee revenue continues to grow. Last year, we were up 77.9%. As you know, most of the restaurants were closed. This year, we were up almost 15% over that 77%. So still really good news. But on the opposite turn of that, when they weren't buying from the restaurants, consumers were buying for take home. So our consumer business did drop in the last quarter of last year. But this year it's starting to rebound itself back up 1.6%. So that's two of the main drivers for our business. Next slide for year to date, you can see the big change there in licensee revenue, up 57.1% this year. And then there's the consumer decline down 3.6%.
Which makes sense.
Next slide, please. This really gives you a good view over the last 2 years. And you look at the restaurant industry, it is recovering. However, I don't want to say they're recovered, right? They still have lots of challenges in front of them. I don't represent them, but I talk to them a lot. Labor recruitment and retention is still impossible to keep folks. And then the consumer demands are changing. So if you look back from October 20th on the left side, October 20 to September 21, you'll see that dip in business when the restaurants were closed. But then it started to recoup itself as we reopened. And then as we move into the pandemic recovery, as I'm calling it, you can see those sales dollars continue to grow. And a lot of that is driven by inflation. So don't be mistaken that it's, restaurants aren't doing that great. Like I said, they are rebounding. They're in a recovery process, but the dollars are growing with inflation. Next slide, please. I'm going to talk a little bit about the consumer trends that continue to, consumers continue to embrace at-home cocktails. RTDs are still a big driving force, especially in the third quarter. I'll show you a slide in there where it increased dramatically. A lot of that has to do with the weather that happened in the third quarter, and then also premium spirits and convenience. Next slide, please. Vodka continues to remain the top spirits category in both revenue and volume. So I've listed the top 5 for you. Vodka was $52.3 million, which its market share dropped about 3%, but still the number one spirit drank in Oregon. And then you can see, the top 5 listed for volume as well. Quarter 12 remains exactly the same, which is the next slide. Again, vodka stays the same, no real big change there. Next slide, please. This is what I want you to watch, and we want to keep our eye on this. I've been talking about this for about the last 2 years. Tequila and Mezcal is growing. It's the number one category, the fastest growing spirits category in both revenue and growth. The same in the third quarter as it is on the next slide, year to date. It makes up a significant portion of the revenue growth that the state's growing on an annual basis. So if you go to the next slide, this is the one that shows really that tequila function. Our total revenue growth for the quarter was $4.6 million. 53% of that, 53% of the 8.8, which is the 4.6 million, is tequila. It's the main driver of our business. Next slide. If you look at the 12 months here, again, you're looking at 44% total. Tequila is the fastest growing. Mezcal's the category within tequila. It's what's growing throughout the state. And then the next slide. This really is RTD. And again, 2 quick slides. The first one is the Q3. You can see that the growth of, in the third quarter was up about $1 million. What's crazy is, last year was 1.3 million. This year, 2.2. So, I mean, it nearly doubled in the same quarter. And then
who's the type of customer who buys that?
Market data suggests that it's anywhere from 21 to 35-year-olds that are buying it. They're looking for it cold, so in a cold box. They're not buying a lot of it dry on the floor. So younger generation and cold. Those are the two. And that's why it struggles in our stores a little bit because we don't have a lot of cold box space for the RTD can cocktail, and the margin's a little bit lower on it. So it's more difficult to get placement on it.
They don't want to give it the shelf space, and they don't have the chill space or in either place.
There's other products that are more advantageous to their bottom line, right?
Yeah.
Right. So the key thing on this one, if you look at the Q3, is the circle chart on the far right, which is the percent. On the next slide, you'll see it's only 0.6% year to date for a rolling 12, but in the third quarter, it jumped up to almost 1%. Now, 1% is still relatively small, right, in the overall business, but to have the business double in the third quarter, just, with seasonality, shows you how seasonal this business is, and it shows you the high demand. Next slide, please. So looking at the 12 months, you can see, the business was 3.1 million prior 12. This past 12, it's, almost doubled, and at 5.4, which is up 2.3 million. And then it's at 0.6% of the overall category. And then the last slide really is some macroeconomic trends, and I'll just read a couple of the bullets to you. You know, inflation is likely to remain a concern, not only nationally, but definitely in our state. While lower energy prices push down the headline inflation, core inflation has remained high. You know, workforce shortages, as I mentioned, and licensees, it continues to be a struggle. Not just for licensees and for liquor stores, but also for Nikki and our distribution center, you know, trying to get the staff that we need. You know, what's funny about that is I read some articles that talked about employment is above pre-pandemic levels right now. And business commentary is full of talk about labor shortages and stories about struggling to find workers nationally. So we're at a higher employment rate than we were pre-pandemic, but we have still too many vacant positions open. Supply chain issues, they did ease a little bit in Q3. You know, things are starting to come back, as we enter into a more post-pandemic era. But I can tell you that 1 out of 4 businesses still tell me they have, extreme challenges. And you can look at our retail expansion for that. We have stores that have been waiting a year to get shelves and supply or permits from the city. It just takes a long, so it's getting better, but it's still a struggle. And then on a positive note, as you can see through third quarter and through the last 12 months, sales continue to grow. That's because consumer spending continues to remain positive. Consumers continue to spend down the massive savings accumulated during the pandemic, and the recovery from the pandemic just doesn't appear to be over just yet. So I really think it's going to continue to drive our numbers north over the next 12 months. And real disposable income is still higher than pre-pandemic levels, and economic growth is slowing, but the economy will continue to grow in the second half of 2022. So,
I got an important question. The workforce shortage, have we dealt with our hourly wage issue? Have we found a way to deal with that, or are we still fighting with it?
it's still a battle for us.
Well, it's an existential battle for us. What do we do about that?
We take it to the bargaining table and do contract negotiations with it, which.
But there's a time period here too, isn't there? Am I wrong with that?
That'll be for the next budget period. So
Yeah,
it's
but-
contract, but that's the earliest time. There is no other remedy for us to move up.
There has to be another remedy. There has to be. I mean, it's an existential circumstance. Are we just going along with, we're surviving, but what am I missing?
It's state process. So let me back up for just a minute.
You know what I'm talking about.
I started at the same time with Jason and Bobo. We all three came out at the same time, and we saw challenges that we could look to improve. One of the things that I was able to do was to put Nikki Leslie in charge of distribution, and she's in the background there, and she never comes up here as I ask her to, but she's done a lot of it. It's about the interpersonal connections that we have with our people to get them to show up. And in the warehouse, that's difficult because a lot of people during COVID stopped showing up. But Nikki and her team specifically made connections with people to get them on board to show up. And I truly believe that people come to work more because they enjoy the environment.
Yeah, but Nikki is wonderful. We know that. Nikki has got a personality that can charm you, but the money talks too. You only can go so far with the personality. This is nuts. This is nuts. We have a big business. There's no other place in the world that would deal with this type of thing. We can't survive unless we do it. And I guess you're telling me I should know this better, right? I should know it. But when you're telling me that you have a big business and you can't get the money, that's nuts.
I don't care about that.
That's nuts.
We have, and we've been through this, right? We have fast food providers paying more an hourly wage than our start. We've had discussions with legislators who also see this problem of us needing immediate remedy without a process available to us to get an immediate remedy.
So there's no
Legislature can solve it, contracting can. We've explored all of the avenues we might be able to prompt any kind of exception from, and we don't have it today. We don't have one.
Would it take legislation to do that?
It would take either legislation, ways and means action on the budget, and certainly work with our union, ASME, to.
Well, yeah, but ASME is gonna be 100% in favor of this. I mean,
Yeah, they are.
It might be, it might be 125% in
Yeah, of
favor
course.
of it, right? But
That's right.
obviously, yeah, they have an interest, but we can't get from A to B now, and we have pursued the process at every avenue that I know, right, through the state process, and raising the issue with legislature. We all kind
but
of
shouldn't this
realize
be a priority of ours as far as
It is a
legislation is concerned?
it is, yes.
As far as legislation is concerned, to give us an avenue to go after this? Shouldn't that be? You can't survive doing this thing.
And I just say historically, wages is one thing, right? This whole business side of the enterprise doesn't move exactly at the same pace of state budgeting and processes for it. But this is a poignant example right now because for a little bit of money, we could have eased a lot of pain in a warehouse that is operating over capacity right now.
Well, is money the answer? Is that?
Yeah,
Is that the
well,
only, or is it just there are other reasons? They're just
No,
not-
it's money. It's we're paying 18, I'm gonna say it out loud because we're paying 18.75 an hour. We can't get people to work for that anymore.
Right now, it's twofold factor. Money's one of them and the primary driver for recruitment. We're not getting a lot of recruitment, not a lot of applicants because of the money. The second is the market is changing. People are not wanting to work belts. They're wanting to go home and work.
They're
From
right.
home on
And-
remote.
And if we raised it to 21 or $22 an hour, we could get people. We've got $1 billion business in which we're playing around with $1.25. Hello, I mean. Yeah, I don't know, you either gotta laugh or cry, but either way, we can't afford to, you can't afford to do this. We have to have a solution to this thing.
Well, we cry and then laugh, then cry again.
Steve, will you do me a favor? And will you ask Rosie or, to look at what kind of potential avenue in legislation that we could have an emergency fund for dealing with these issues? I don't know if that's the right way to go. You know better than I do, but there has to be something that we can do in the future.
I understand about the contract that goes through the negotiations.
Will somebody do it and get back to me
Yep, absolutely,
and make it a priority?
absolutely.
All right.
Mr. Chairman.
Huh?
Very good.
It's not.
Yeah.
I said it 12 times. You don't run a business like this. And it's not anybody's fault here. We just don't have the tools.
Before I go to questions and answers, I'd like to give you just a brief warehouse update, following Boba's presentation. The warehouse has been kind of, in schematic design, as we call it, right? Space planning. We're looking at, the architectural of the building and trying to get all that pre-work done. In the meantime, we were waiting so we can get an RFP released for a CMGC or Construction Manager General Contractor. That program got delayed a little bit. We've got it back on course now. Got some great news about that. I found out yesterday, it looks like that RFP is going to be released either next Wednesday or the following Wednesday, so the 21st or the 28th. Assuming everything lines up, because we've done back and forth with DOG already, we're in a really good space. And what that means for us is that we're continuing on our timeline, no more delay. So we're in good shape there. That's the positive side. On the other side of that coin, we're struggling for space. We're at capacity 98% of the time. We're doing work to mitigate so that we can continue on. We're having to increase our dollar amounts for delisting so we can move SKUs out, so we can continue to take new products in, because as our warehouse continues to get the squeeze, products continue to evolve. And we need to be able to offer the diversity in our catalog to keep our business strong. So we're working really hard to make that transition. And as Jason said, all the success that he has earned comes from his people. I would echo the same. Give a shout out to Brian Fleming and Nikki Leslie for the work that they do on retail services and in distribution to keep themselves and their teams to keep the revenue streams flowing that he's seen in Oregon. So other than that, on the new building, I think Rosie's preparing a tour for some legislators in January, so we can show them, what we have today versus what we're, trying to build for tomorrow. So we can educate, again, continue that ongoing conversations. Right now, it looks like that CMGC should be on board around April or May. And once that CMGC gets hired, we can start hiring subcontractors, which will move to the design development side of the building. And that will lead to putting the shovel in the dirt at some point shortly after that. So, it's exciting. We're moving forward, but we have a lot of work to do. And we have a lot of questions we're being asked about. So with that being said, I'll turn it over to Steve.
Chair, I just want to say, the efforts that were made this season, this is really the beginning of our real capacity crunch in the warehouse. Thanks to Chris's work, Nikki's work, planning by management. Chris can tell you about earlier investments of some flow racking, putting spots together. But the fact of the matter is, our ASME workforce and our management and our anticipation, working with the agents, getting front-loaded orders. This all starts, well before Thanksgiving, then Christmas, New Year's, Super Bowl. This is when we make the money for the state. This is when the crunch happens. And a lot of that ability of us to hit our revenue marks this year in that warehouse that was overcrowded was because of the mitigating actions that we've taken before. The idea that we're going to be able to do this for 1 more, 2 more years, especially in this time period, really highlights the immediacy of impact that a new warehouse will have for us when it comes into operation. At some point, you got to spend a lot more mitigating money to find a place to move liquor. And our vendors that were a part of this, right, Nikki, had to get product out of the warehouse. It wasn't moving to create a room for it in place. Our manufacturers understood that, right? They know what we're trying to do, fulfill the orders out there. And we did it, right? We did it this time. It's going to be harder next year, and it's going to be super hard the year after that. So we're at that edge of not being able to gain or fulfill all the demands from orders that the Oregon Public has. Irrespective of what, alcohol levels are, and Chris gave the QPR, and it shows, quality over volume, right? And that's been a trend for a long time in what we do. But I just want to point that out because it's, directly related to our quick action on moving forward with development of the warehouse and the headquarters.
Any questions?
I have a question.
Commissioner?
Could you break it down to me so that I can understand really like ABC? What is preventing the wage increase?
So we, every 2 years, we negotiate a contract with the union, management service does. And then there's also a bigger scale contract that's done at the table for the state. So the table at the state pushes down to the agency, and then we negotiate with our local union. And that sets the bar for the next 2 years for whatever the wage will be, whatever the class rate.
So where
also
are
has-
we though? Where are we in that 2-year period?
we start bargaining again in a couple months.
Oh,
So
We're a year and a half, right? It's about 6 months
Yeah.
left in the biennium before the new contracting after the state gets done putting the budget, the legislature gets done putting the budget.
so the earliest that you can offer like 25 an hour wage would be in 6 months time?
you would negotiate it at the table locally, and then it would go for approval at state level. And assuming those two got through, then it would be initiated at the next, once the contract was signed.
There's a reclassification, but that also takes time to put together. So, we explored that route as well, but both routes don't get us there quickly.
No, that's my whole point. That's never quick.
The Director Mark's point, that you can reclass the positions. We've done that. We went through that reclassification with warehouse workers in the last year and a half and got the most amount of money that they would allow us to get at that time.
What about creating a new classification? Is that going to take even longer?
We did that at the same time we reclassed. So we had 3 positions.
Oh,
We have been jumping rope with this for a while.
Thank you.
If there's no other questions, listen, I'm compelled to make a couple of comments on this as chair. We're at 98% capacity. For people who don't know it, on a biennium basis, we contribute over $500 million to the state of Oregon in terms of revenue. Those are the first 2 things to keep in mind. I want to take a moment to talk about the recent media coverage that we received on the warehouse project and the cost of obtaining that property. First of all, I'd like to say that article was fair. And I would also like to say it was accurate and it was well written. So my comments are certainly not in any way defensive in terms of that article. I do think it was fair. As chair, I'd like to point out a couple of different things. One, as I said, we're an agency and the only state agency that I know that runs as a total business. I mean, this is 100% a business and it's a big business. We are the 3rd largest revenue producer for the state of Oregon. And during the pandemic, we were probably the 2nd, and we're probably close to that. I don't know what the figures are. But as I said, it's a big, big business. One of the things that drives me crazy is we can't find a $1.25 for our workers when we contribute $600 million plus to the state of Oregon. 3 years ago, there were 9 sites that were available for us to have consideration on. This is a complete open meetings process that we do. Everything is open for us. There is nothing that's closed. The only thing that was closed is that when we were looking at these pieces of property, obviously we couldn't tell the public, but the commission was actively involved in it because it would affect the price of the land. So 3 years ago, there were 9 sites. By the time we looked at them, there were 4. They were gone. One of the biggest problems in this state is land and the availability of land. And the prices go up, up, and up. So when we looked, we went to 4 different sites. By the time we were ready to look at a site, there was 1 left that met our needs for the future. I mean, from that point of view, we looked at it, we got all the information on it, and we readily admit that the cost of that only remaining property was high. No question about it. But let me point out something that the business math is very simple and financially sound for this project, is that we either paid a premium for a very good optimal piece of property for business operations because no other properties were available, or we would endure the future cost and revenue loss in the 2025 to 27 revenue budget. The calculation would show that revenue risk for the 2025-2027 biennium, which was $185 million, would be at a minimum 14 times greater than the $12.8 million premium we paid on that land. that's simply a business decision. I mean, again, there's no, in conclusion, in my opinion, this was the right decision based on the immediate and, more important, the long-term loss of revenue for the state of Oregon. Over the next 10 years, we've said this many, many times, over the next 10 years, it's 1.5 billion in business revenue at stake and nearly 600 million in funding for the state, county, and city public services. You take away that $600 million in any way, shape, or form, and you have a catastrophe on your hands. And when you talk about all of the different city, state, county, addiction, rehabilitation, everything you're talking about, and that's a little bit different because that's on the marijuana side. But when you talk about that money and you talk about a reduction of another $1 billion by having a 98% warehouse, the money we paid was well worth every single penny of it. That's all I'm going to say on it. That's enough. But I think it's important to understand that. And it's really important. Will you do me a favor? Let's get in touch with the right people and find $1.25 an hour.
Yes, sir. Yes, sir.
I mean that. Let's do that. Chris, thank you. I appreciate it.
Thank you.
Okay. Extension of the, now we go from one thing to the other. The possible extension of the 50% surcharge on distilled spirits product for the 23-25 biennium. Steve, you're up.
Good. The action item in front of you that we'll be considering is extending the current temporary 50 cents per bottle, 25% per mini bottles surcharge that is scheduled to expire June 30th, 2023. The proposed action is renewable. That was originally initiated, I think, in 2009 and 11, and has subsequently each 2-year budget period been reauthorized by the commission. This time, the surcharge is continued at 50 cents, would generate $45.2 million for the governor and legislature and state to expend in the 2023-25 budget. Note, these funds go directly, the surcharge goes directly to the general fund. It does not run through the liquor distribution to state, county, and city. So the timeline for your actions of consideration, we noticed this on November 22nd of 2022. Comment period started then and runs through January 6th, next year in 23 at 5 p.m. So there's an opportunity for verbal comment today, and I believe we have one that will be joining us remotely, at least one. You've had some written comments that have gone into your record, and we'll compile all of those for and against before you take final action. That final action is proposed to be taken on January 19th, 2023 at your regular commission meeting.
Thanks, Steve. We do have public comment from Adam Smith, Vice President of Government Relations. From
You might.
He had to jump off, so he's gonna submit written.
Okay. Very good. Budget and revenue update. Colin, are you there?
I am here. Good afternoon, Commissioner and members. For the record, my name is Colin Nealand, and I'm the Chief Financial Officer for the agency. So how is everyone doing today?
Good.
Good. Well, thank you for taking the time to allow me to come together in front of you and provide the agency's quarterly financial update for you all. What we'll be talking about today is providing a brief update on where we are at following the information we discussed back at our July 2022 commission hearing regarding our 2023-25 agency request budget. And then the information that you have in front of you today will be some information I'll be going over regarding the liquor sales that we have seen over the last 12 months from October of 2021 through September of 2022. And we'll be taking a look at liquor sales in the terms of dollars and then by cases. And then we'll be taking a look at the amount of that money that ultimately translates into what gets distributed to the state general fund and cities and counties and other aspects of things like mental health over to Oregon Health Authority. And then lastly, we obviously have heard a lot today from people regarding various aspects of the agency's oversight into cannabis. And so one of the things I wanted to touch on a little bit is to provide some financial information regarding revenues that we receive in our recreational marijuana program. And that's something that I can look to talk to the commission more about in future meetings. So the first update I wanted to provide is that we are, as we've expected with a new incoming governor, it's normal for that process to take longer and for the governor's budget to not be released on December 1st, as it typically is when a sitting governor is going over and providing their recommended budget to the legislature. So we are still where we thought we would be, which is we are waiting for the governor's budget to be released as a recommendation to the legislature. That can really come at any time between now and the first part of February. And so that's one of those things that we are in a position where we will see it when we see it. And then once we have that information, I will definitely come back to the next commission meeting and provide an update on what the governor's recommendations are for OLCC as we head into the 2023 legislative session. So the update there is more to come once we have that information. And then the information I wanted to go over today is to begin taking a look at liquor sales in dollars as we're taking a look at the October 2020, September 2021, or through October that you can see there. And what I really wanted to share with everyone is that what we are seeing is that revenues are up 5% over this period. And total sales were approximately $850 million. So of course, if we take a look at a biennium, and of course, this time frame does not fit exactly within the state biennium, which runs from July, in this case, July of 2021 through June of 2023. So the time frames are a little different here, but it still gives you a pretty good approximation of what we'd be looking at of in the neighborhood of $1.6 to $1.7 billion on a biennial basis in liquor sales. And then Laura, if we could go to the next page, please. And then what you see here is taking a look at, while sales are up, what we are also seeing is that the overall cases of liquor sold are relatively flat. And so this is something that I believe you've heard Director Marks and Chris Mayton speak on, and myself in the past, is we are seeing customers purchasing what we call the premiumization of the products. So they're buying higher end products, which is driving the increase in the revenue that we are seeing. And of course, what we're also seeing is the prices of those products are going up, as one might expect year over year. But as far as the quantity being sold over this 12-month period, there really was no significant change. So that's an interesting aspect that we're continuing to watch, is that we're seeing that 5% revenue increase on the same quantity of being sold, although the products being purchased are on the higher end of those things. And so that's something that we'll continue to monitor as we continue to go through the rest of this biennium and into the next. And then Laura, if you go to the next page, please. And so this is a table that provides a comparison to the prior 12 months that we'd be looking at, and then the 12 months that we were looking at for the information we were talking about. So taking a look at that October 2021 through September of 2022 timeframe, and this provides a month-to-month amount of distribution, and this involves all that we were distributing, the 56% to the general fund, 34% to the cities, 10% to the counties, and then other aspects as well. And so you can see the increase down there. We went from about 316 million over the time period back in 2020 to 21 for these months to almost 323 million. And so definitely moving in the direction that we would expect with revenues being up. And obviously this touches on everything that has been discussed today on the fact that OLCC generates over $600 million of biennium that goes to the state general fund, cities and counties and other places. And that is a huge revenue generator for the state of Oregon and for all the folks that depend on this revenue stream. Laura, could you go to the next slide, please?
Could you go back to that for 1 second, please?
Sure.
I'm going to ask a question that is probably impossible for you to even consider, but I'm going to ask it anyway. Could you play around over the next month or 2 or 3 and give us some estimates that if the state of Oregon were to go private, what kind of revenue we would look at on here? It's almost impossible. I'd like to get some idea on that of how that would affect us.
Okay. That's definitely something that I can work on with Director Marks and others.
Zero.
Yeah, well, it's not going to go to zero, but it's important for us to at least understand that somewhere. That's why I said I know it's tough, but it's I'd like you to play with it, Colin, if you can.
Sure.
Thank you.
Definitely do that. My pleasure. Laura, can we go to the next slide, please? And so I wanted to, oops, I think we skipped a page, but that's, that's okay. And so I wanted to provide a little more detail on the totals that we were seeing there on the 322 million, just so that you could see that. And so what you see in front of you here is this 12-month time frame for the amount of revenue that was distributed to the cities. And the cities actually receive a couple of different aspects in the distribution of liquor revenues that are sent to them. And overall, they receive a 34% distribution, but within that, 20% of that distribution is per capita. And then an additional 14% is based on a formula that takes into account property taxes, population, and income. So the distribution to the cities is a more complicated one, but it takes into account all those different aspects. But in total, they receive 34% of the available revenues to be distributed to them. And you can see over this 12-month time frame, rounded slightly, that equated to $100 million to the cities around the state. If we go to the next one, please, Laura. And then for the counties receive 10% of the overall distribution. And so you can see there that equated to a little over $29 million over this 12-month time frame. And then some of the other revenues that I wanted to talk to you about today is the state general fund also receives part of this distribution, as we know. 56% of that distribution was sent to the state general fund. And over the time frame that we're talking about today, that was over $164 million. And then I'll need to add just a little more detail to ultimately the documents that we send out to you after those meetings, because down here under other distributions, what we also have is, in addition to the state general fund, cities and counties, we also distributed in this 12-month time frame over $9 million to Oregon Health Authority for mental health programs and addiction. And then our 50 cents bottle surcharge provided roughly about $20 million of that distribution. And then, of course, the Oregon Wine Board made up a little over 300,000 of that. And so in total, these are the details that make up that $322 million distribution that we looked at a little bit earlier. And then Laura, if we could go to that last slide, please. And then the last thing I wanted to talk about today is I didn't just want to do a financial presentation on what we were seeing on the distilled spirit side and regarding our revenues and also the quantities that are being sold and ultimately how that what enabled us to be able to distribute funds to the state, the cities, and the counties. I also wanted to touch base a little bit on what were the recreational marijuana revenues that we saw over this 12-month period. And what you can see here is that those revenues were about $16.4 million over this time frame. And interestingly enough, when we look at all of the liquor-related revenues that we were just discussing over the same time frame, this 16.4 million equates to about 2% of those revenues overall. And the interesting thing about that is that from an agency perspective, our recreational marijuana program has 80 positions authorized out of the 383 positions across the agency. And so we have an interesting situation where we can see that from an overall revenue perspective, this program generates about 2% of the revenues during this 12-month period. But from an agency authorized position and obviously all the operational needs that we have makes up about 20% of our authorized positions.
Colin,
and so that, yes.
A stupid question. This revenue from license fees, does that include the complaint fees or the penalties that we initiate as well? I don't. Steve?
I believe I will double check that and let you know because that's
Bill
before
is,
I may.
Yeah, Bill is saying that it does, but the question I'd like to know, just because we sit here all the time, right?
Mm-hmm.
I'd like to know what percentage of those licensing fees are attributed to the penalties that we impose. Yeah, I mean, we're sitting here doing it all the time. We might as well find out.
We can definitely break out that number. Just so you know, that goes directly to the, forget its proper name, fines and assessment account of the state, and they.
But it's included in this figure.
Yes.
So I would, we
want to break it out, yes.
Yeah, maybe Bill can do that.
Yeah.
Yeah, he'll do it. It'll save you some time, Colin, but.
Well, Bill saves me all sorts of time. I really appreciate and value Bill's contributions to the agency every day.
I hope that's both ways.
One can only hope. So this concludes the information I was looking to present to the committee to the commission today, and I was really something that we obviously want to bring this information to you all on a quarterly basis, and of course including recreational marijuana. To your question, Chair Rosenbaum, this is part of what we are working on as an agency, is to continue to bring the information that you've historically seen, but also to continue to bring additional information to you while still being sensitive, of course, to your time, so that we can continue to provide a more holistic picture of the agency's financial position and operations. I really appreciate your time today and be happy to answer any questions.
Colin, I'd like a copy of this sent to me, please. I don't know if any of the other commissioners want it, but I do.
Absolutely.
And if you can get a printed copy, I'd appreciate it. Okay. Any questions, commissioners? Nope, we're in good shape. Colin, thank you.
Thank you. Happy holidays.
Thank you, you too.
Thanks, Colin.
Okay. We're moving with such speed. We got the rules up now. Nicole? Well, you've been patient.
I will be quick today. Good afternoon, Chair Rosenbaum and Commissioners. For the record, my name is Nicole Blase and I am the Rules Coordinator for the OLCC. I'm here to present one rulemaking action for your consideration today. The first item for a final action is the Division 5 and 6 Alcohol Licensing Modernization Package. This package modernizes administrative rules in Chapter 845, Divisions 5 and 6, to keep up with the gradual but continual changes to the needs of the alcohol industry, public, and OLCC. This rules package proposes technical updates to amend, repeal, and adopt administrative rules in Chapter 845, Divisions 5 and 6. And staff, or I would be happy to answer any questions.
Commissioners? I only have one, and I have a lot more, but I only got one. Under the rule, I think it's 845-005-0400, you have to maintain liquor liability insurance of not less than 300,000. I think that was a change.
Is Dan Croy here? He is the author of this rules package. He was supposed to be.
There he comes.
There he comes.
Oh, there I am. There we go.
Hi.
Yeah, for the record, Dan Croy, I'm a operation policy analyst here in Alcohol Land. Yes, I was one of the shepherds. I don't know if I authored it, but I was one of the shepherds. So, Chair, that rule has been there for many years. It's actually based on a statute requirement. Really the only thing we did with this rule were a few housekeeping things. Primarily.
It is that, oh yeah, well, my question was not the 300,000. My question was that the commission has to maintain be maintained as a certificate holder. That's new, isn't it?
No.
Okay. That's always been there, because the way I read this, it looked like it was a change. I just I agree with, I just want to know the thinking behind it.
Hold on, I'm pretty sure.
Marvin, you?
The two insurance guys said, yeah, that's what's supposed to be.
There wasn't any changes, because the way I read it at the beginning is that was a change in there, it was crossed out and added.
That's okay.
Okay, if there's no change, then I don't have any questions. I take the expertise of my brothers on the commission here. Thanks, Dan. I'm done with it, Dan. Don't worry about it.
I think Dan is.
I think he's frozen.
But,
Very nice.
All right. Because if you look at the language in there, that was crossed out and put in.
I didn't see that.
So I didn't understand that. Okay, if there's no other further questions, I need a motion.
Chair.
Commissioner?
I move to amend 845-005-034, 0311, 0312, 0320, 0321, 0325, 0326, 0360, 0366, 0400, 0405, 0410, 0412, 0413, 0414, 0415, 0440, 0445, 845-006-031, 0335, 0340, 0345, 0350, 0399, 0425, 0459, 0460, 0461, 0462, 0464, 0465, 0475, 0480, and 0482 to repeal 845-005-303, 0306, 0314, 0315, 0329, 0331, 845-006, 0309, 0430, 0481, 0490, and to adopt 845-005-0401 and 845-006-0341, effective February 1, 2023.
That
Yeah.
wasn't the record. Commissioner Curran has the record. But it's pretty close.
I'd say last
Thank
one's
you,
a little
Commissioner.
longer.
Take the roll, please.
Commissioner Curran,
What do you guys need?
Commissioner Curran? She's still on there. She's still there?
Yeah, the whole internet just went down. Here we go.
Well, let's leave the record open for Commissioner Curran.
Commissioner Doherty,
Yes.
Commissioner Floyd,
Jesus.
Commissioner Japon Porter,
Yes.
Commissioner Miletus,
Yes.
Commissioner Revolt,
Yes.
Chair Rosenbaum.
Yes. And we'll leave the record open for Commissioner Curran. All right, thank you so much, and thank you for your patience. Last but not least, we have the one-legged executive director of the department. We have to have some levity here, Elgin. Steve, you got any comments?
No, we get a lot today, right? And a lot, you're as current as I am on a ton of information that we pushed forward to you today. Some excitement, new governor-elect coming into place, and everyone's waiting to see the processes of working the budget through, looking at our legislation and how they're going to approach those things, and that just takes time. So everyone's providing some patience there. And she's got some clear ideas about what she wants out of performance of government. I think that's going to call on us to better delineate what our goals are as an agency and expressly monitor those. Part of a project, quite frankly, that Commissioner Doherty heard about yesterday. We're doing some work already on increasing our performance measures, and we've audited what we got and take that information, translate it. Perfect opportunity for us, perfect timing for this agency to make those ties better. And behavioral health is going to be important. That's us. We're going to be involved in that. I'm glad that we're doing a lot of work in that regard, from minimum floor pricing. We've hired a health policy advisor. You just saw the work of the study NAPCA funded based on our work with them and researcher Julia Dilley on that work, body of work around how home delivery takes place and how we protect the public. And I think a lot more to come. We're working with responsibility.org. The corollary to rethink the drink, right, is the industry's ABCs of ABV. And we don't serve teens. All of those are just reflective of part of our work there in coordinating with the Governor's Alcohol and Drug Policy Commission, and then with the work that we do with OHA and the evaluation now required by our rule to evaluate the public health impact along the financial impacts of the actions of our rules, the actions we take. So I think there's a lot of things we have to talk about there, because the products that we put out there also have a big impact on those issues that the governor and state, incoming governor and the current governor care about a lot. So I'm looking forward to engaging on that and moving forward on the warehouse. And January is the beginning, right? And so you get a sense of all that legislative package out there, and most of that's pretty easier load, I think, than we've had in the past. A lot of it, quite frankly, is decisions the legislature needs to make to help us and help you figure out where it is. I think they're going to make the big cut decision on the economy and whether we can continue the moratorium, right, and how we do it in legislation. you know, we can contribute to that discussion as a commission. So, and you know, some of those items I can tell you we're not as fond of. I think Jesse knows this, and all the marijuana industry knows that camera monitoring proposal they got. We've got a lot of work to do with them because cameras are an important part of our compliance.
Oh, yeah.
So a lot of changes coming, but I feel really good about where we're entering next year. And we couldn't have got there without this incredible workforce we got. I just want to tell you, I can't remember the formal name of the internal toy drive we did. The outpouring of giving to that and amongst this staff, it was just incredible. We'll get you the stats and send you a note on that report. It was really cool. So appreciate all that and the hard work of everyone as we all move into the holiday season. And this is my only opportunity at the commission level to thank everyone for the work you've done for the past year. Be at the commission next year.
Happy New Year, and we're adjourned.